Hello, everyone. Welcome to Mediccom Event 2. And my name is Aryan Chaudhry.
And I'm Namitha Pasanuru.
And we're the founders of Mediccom. Just letting you know, this session is recorded. And so, yeah, most of you have given your consent anyway, all of you. So thank you for that. And I'd like to introduce the session, which is a COVID debate session. And we'll have various debate topics, which we'll have groups debating either side, and we'll have our guest speakers. Our first judge for today will be Avril, who is a Cardiff Sixth Form Year 13 student, now going on to university, who is in the debate committee, and he's been in multiple competitions, so he has the experience and knows debate inside out. He'll be providing you feedback on your public speaking and letting you know how that works.
And also at 3 o'clock, we have our guest speaker, who is a doctor. He's been working in the Heath and the Royal Glen Hospital, especially during COVID. He's done a lot of work also in ENT. So he's very experienced, and he's got a lot of stories to tell us about COVID, working with patients that had COVID, getting COVID himself. So he's going to have some very interesting points to make, and we hope you have some very interesting questions to ask. So you can put that on the Slido, and that would be great. Thank you. Okay, but first of all, we have a committee presentation. Why are we making the presentation? Just to inform everyone about COVID-19, but it's such a relevant topic, we thought it would be more interesting to do debates. So for all of you guys, but we will be doing a presentation just so that everyone understands the whole thing.
As most of you know, this is our committee. This has been the team responsible for organising Mediccom and this presentation.
These are the topics we intend to cover in our presentation about coronavirus. We intend to educate and make you wonder how much COVID-19 has affected our way of thinking. We will first look at how COVID came about and how the virus itself works. Next, discussing spreadability and how COVID stands compared to other epidemics.
We will look into the variants for each COVID strain of note and how they vary between one another. Next, complications with said variants and how COVID itself becomes such a big problem in patients.
Additionally, we will summarize current treatments and vaccines, and following that, we will summarize the prevalence of COVID-19 around the world, looking at specific analytics, and to finish, we will look at the ethical concerns that COVID-19 has brought up.
So, as Darshan said, our aim is to provide as much information as we can for your benefit. So I'll try my very best to explain how COVID-19 invades the body and how our general symptoms arise by breaking down this diagram into manageable pieces. So, starting off with the alveoli. As you know, this air sac is responsible for rapid gaseous exchange. In this diagram, COVID-19 has infiltrated the respiratory system. Now, the virus itself is non-living. However, it is made of a protein coat called a capsid and has receptors like all viruses. What is of note is that COVID-19 has S-spike glycoproteins and positive sense single-stranded RNA, which is a gene needed for the infectious cycle while simultaneously being an mRNA molecule. So, for the alveoli lining is made of two types of cells, type 1 and type 2 pneumocytes, each responsible for different things. Here, we can see the virus beginning to enter one of these cells, causing a chain of events that have an incubation period of 4 to 14 days. The virus has has specific spike proteins, as mentioned before, which binds to the specific receptors on the cell, being angiotensin converting enzyme type 2, or ACE2 receptors, and transmembrane serine protease type 2. Using the spike-like protein on its surface, the SARS-CoV-2 virus binds to ACE2, like a key being inserted into a lock prior to entry and infection of cells. Hence, ACE2 acts as a cellular doorway for the virus. This allows phagocytosis of the virus, allowing the cell to engulf the virus as the cell membrane surrounds it. The virus disintegrates and has ssRNA that uses the host cell's ribosomes to hijack translation and hence making different polyproteins. After synthesizing these proteins, the ssRNA can use RNA-dependent RNA polymerase, RDPD, enzyme, which takes ssRNA and converts it into more RNA. The polyproteins must be folded with intermolecular bonding into different proteins to remake the capsids of the new viruses. New viruses are finally formed through the use of proteinases that combine capsid proteins with ssRNA to make new COVID viruses, which leave the damaged cell by exocytosis. This is how viruses use cells as virus-producing factories, and hence infection spreads. The damaged pneumocyte now, as a response, begins to release damage-associated molecular patterns and inflammatory cytokines to the alveolar macrophage, which are present in the alveoli for phagocytosis of such invaders. Once the macrophage is stimulated by inflammatory cytokines, it releases different types of inflammatory mediators, which are made to send signals to the immune system to deal with the infection. These inflammatory mediators cause endothelial dilation. This is done by increasing capillary permeability as more tissue fluid enters the capillary when it undergoes vasodilation. Generally, this immune response is controlled. However, in this scenario, COVID overwhelms the immune system. Hence, tissue fluid starts to leak into the interstitial spaces, accumulating above the alveoli. The liquid accumulates into the alveoli too, which is called an edema. Technically, this drowns out surfactant, which is a chemical used to decrease the surface tension in the alveoli. Since there is less surfactant present, surface tension increases. Laplace's law states the pressure is 2 times the tension divided by the radius. Increasing the surface tension causes increased collapsing pressure in the alveolus, which leads to alveolar collapse. This causes decreased gas exchange and hence a condition common in COVID patients called hypoxemia, which is low oxygen concentration in blood. Alveolar collapse also increases the work of breathing because the pressure of the alveoli becomes higher. Hence, causes a phenomenon known as ARDS, which is called acute respiratory distress syndrome, which will be discussed later.
In the news this week, it was confirmed that children are at an extremely low risk of having serious complications from COVID-19. Why is this? One of the hypotheses shows that this is due to ACE2. It is an enzyme that generates small proteins by cutting up the larger protein angiotensinogen, that then go on to regulate functions in the cell. The receptor is present on many cells, including epithelial cell, or the nasopharynx, lungs, heart, kidney, intestine, liver, and central nervous system. Children seem to have a high concentration of ACE2 protein in their body as compared to adults. Many would think that this would increase the risk of COVID, but the total opposite occurs. One possible explanation could be that in children, there's a higher ratio of ACE2 to the virus, meaning that there is still some ACE2 which has not been binded, which will cause a negative feedback loop mechanism to try and restore the patient back to normal. This is because ACE2 is a vital element in biochemical pathway that is critical to regulating processes such as blood pressure, wound healing, and inflammation, called a renin-angiotensin aldosterone system, or the RAAS pathway. ACE2 helps modulate many activities of the protein, called angiotensin II, that increases blood pressure and inflammation, increasing damage to blood vessel lining and various types of tissue injury. ACE2 converts ANG2 to other molecules that counteract the effects of ANG2. Of the greatest relevance to COVID-19, ANG2 can increase inflammation and the death of cells in the alveoli, which are critical for bringing oxygen into the body. These harmful effects of ANG2 are reduced by ACE2. When the SARS-CoV-2 virus binds to ACE2, it prevents ACE2 from performing its normal function to regulate ANG2 signaling. Thus, ACE2 is inhibited, removing the brakes from ANG2 signaling and makes more ANG2 available for injured tissues. This decreasing brake likely contributes to injury, especially to lungs and heart, in COVID-19 patients. Angiotensin converting enzyme, or also known as ACE1, is another protein, also found in tissues such as lungs and heart, whereas ACE2 is present. Drugs that inhibit the actions of ACE1 are called ACE inhibitors. Examples of these drugs are ramparil, lisinopril, and enalapril. These drugs block the actions of ACE1 but not ACE2. ACE1 drives the production of ANG2. In effect, ACE1 and ACE2 have a yin and yang relationship. ACE1 increases the amount of ANG2, whereas ACE2 reduces ANG2. By inhibiting ACE1, ACE inhibitors reduce the levels of ANG2 and its ability to increase blood pressure and tissue injury. ACE inhibitors are commonly prescribed for patients with hypertension, heart failure, and kidney disease, which will be explained in further detail later. The fascinating point here is that in children, it has been seen that this process occurs more naturally than in adults, which could be a possible explanation why the risk of COVID in children is much less severe.
When discussing the epidemiology of a disease, mathematics is usually needed. To understand the epidemiology of novel coronavirus, we can compare it to other epidemics that have occurred. A key factor is looking at the virus reproductive rate, which, by definition, is the expected number of cases directly generated by one case in a population, where all individuals are susceptible to infection. In terms of novel coronavirus, the reproductive rate is said to be around 2 to 3, which means for every person, 3 more people can be infected in a worst-case scenario. For a comparison, influenza has a reproductive rate of 1.3, which is quite low, showing that its spreadability is very low. Furthermore, they look at series interval of coronavirus. Generally, what is considered is a lower series interval is more lethal as it spreads quicker and faster. So the series interval for coronavirus is 7.5 in the 1 to 14 day incubation period. So this 8-day interval represents that you can go 8 days without spreading the virus, whereas with influenza, the series interval is only 2.5, hence it spreads much more rapidly in the same amount of time.
So we have covered how the COVID-19 virus infects a human cell and replicates using a host cell. The replication process is very quick and usually quite messy, so there is potential for an error in the genetic code known as a mutation. There are many possibilities, such as a silent mutation, which has no effect, a mutation that puts the virus at a disadvantage, or an advantageous genetic change can occur. This can make the virus better at infecting people or evading our immune system. As infection rates increase, the likelihood of this mutation occurring is higher, so there is a higher chance of variants forming. Once an advantageous genetic change appears, viruses with the advantage quickly become the dominant strain. These variants have been categorized by the WHO as variants of concern. So I'm going to explain the characteristics of each variant by comparing it to the original SARS-CoV-2 virus, which is known as the D6416. So this is the basic structure of the coronavirus that was first detected in Wuhan in 2019. It consists of the envelope protein, the membrane protein, and the nucleocapsid protein, and the positive sense single-strand RNA is inside. Here's what the COVID genome looks like. this is what each section would code for. Our primary concern here, though, is the spike proteins, because the variants experience mutation at the spike protein. This helps to increase viral entry or helps the virus to evade the immune system. This RNA is translated in the ribosomes to make more RNA and spike proteins. It is then transported to the Golgi body, where protein modification occurs, and the molecule is packaged into vesicles for it to exit the cell via exocytosis. So I'm going to compare how the variants differ to the original genetic code that you've just seen. So first we have the alpha variant, or the Kent variant, which is a B117 variant. So there is a mutation that occurs at the N501Y, which changes the spike protein, allowing it to enter the cell more easily or quicker. With more viruses coming into the cells, there is an increase in viral replication and infection in the tissue. This means there's more viral production, therefore an increased viral load in the individual. So this means that the virus is more transmissible via the aerosol droplets. This means, another mutation is the deletion of the amino acid HV69 or 70 amino acids. This deletion may restrict antibodies from binding to the spike protein. So this may lead to the evasion of neutralizing antibodies. However, this is quite rare, as even if the antibodies cannot attack that specific part of the spike protein, it could attack any other area. And worst case scenario, the memory T cells and the memory B cells are very difficult to bypass. The third mutation is the substitution at P618H amino acid. Again, this alters the shape of the spike protein and increases the activity of the site where the spike protein is cleaved. So this increases viral entry and increases activity, as I mentioned before, and will allow more viral entry. The second variants are the beta variant, which is the South African variant, and the gamma, which is the Brazilian variant. So they're quite similar, as they both have the same mutation from before, which was the mutation at N501Y, but it also has a mutation at E484K. This alters the shape of the receptor binding site, which increases interaction between the ACE2 receptors, which again allows more viral entry. Finally, we have the recent Delta variant. They have two significant mutations. The first one is P618R, which changes an amino acid at a spot directly beside what is called the furin cleavage site. And this is a key step in enabling the virus to invade human cells, thus enhancing its viral infectivity. And then lastly, we have another mutation there, L452R. This mutation has been found to make the virus more transmissible than other strains, and has also been associated with the reduced antibody, the effectiveness of the antibodies, and reduced neutralization. So there are many complications from all of these variants. So as we know, as Arian mentioned previously, the alveolus fills up with a mixture of tissue fluid, dead cells, immune cells, and cell debris. This mixture is called consolidation. This can be observed in the CT scans, as you can see there, as what is called ground glass opacity, or white lung. So if you look at what a healthy lung should look like, there's quite a clear sort of dark space where the lungs are, whereas in a COVID patient, it's no longer, it becomes very opaque basically, and this is known as white lung. This can also be observed in a chest x-ray. So as you can see, we can clearly see in between the ribs there, the dark gaps, whereas in a COVID patient, that's not there. So that's how we can detect it. And basically now what we have is called a cytokine storm. So as Ari mentioned, you have your inflammatory mediators. They are released. So for example, this could be leukotrienes or prostaglandins. They activate the receptors connected to your cranial nerve. This basically allows for a cough reflex, which is why patients have a dry cough. Another issue is the systemic inflammatory response syndrome. So cytokines can increase the activity of proagulants, procoagulants in the systemic circulation. This promotes clot formation, so you have multiple clots in the systemic circulation. And once you start consuming your coagulation proteins, this means that when clots are needed, it is not possible. So this is known as disseminated intravascular coagulation. And the inflammatory mediators interleukin-1 and TNF-alpha can move through the circulation and act on your central nervous system, which signals the hypothalamus, and that increases body temperature, which is why patients also experience fever. These are the extrapulmonary complications. So first you have, if COVID infects your olfactory cells, the ACE2 receptors on those cells, you will have a decreased sense of smell. Same thing with the gustatory cells, you will lose your sense of taste. And also, if they infect the pharynx, this could lead to pharyngitis, otherwise known as a sore throat. Of course, we've talked about the infection of the lungs, inducing viral pneumonia. This leads to ARDS. As I mentioned, it can lead to systemic inflammatory response syndrome, and this could even lead to multi-system organ failure. I'm going to quickly explain the effect on multiple organs, starting with the heart. Decreased cardiac function, which leads to cardiomyopathy. And as you can see, there's all of the following complications for each of the organs if they were to be infected by the COVID-19 virus. For example, if the ACE2 receptors on the organs are damaged on the kidney, this could lead to oliguria, which means reduced urine production.
So what treatments are there for COVID-19? One medication used to treat COVID is dexamethasone. What is dexamethasone, and does it work against COVID-19? Dexamethasone is a corticosteroid used in a wide range of conditions for its anti-inflammatory and immunosuppressive effects. It was tested in hospitalized patients with COVID-19 in the United Kingdom's National Clinical Trial Recovery and was found to have benefits for critically ill patients. According to preliminary findings shared with the World Health Organization, for patients on ventilators, the treatments were shown to reduce mortality by about 1/3, and for patients requiring only oxygen, mortality was cut by about 1/5. What are the typical side effects of dexamethasone? Dexamethasone is generally safe. It presents a favorable benefit-risk profile, particularly in patients with severe forms of pneumonia, while the benefit is less prominent in patients with non-severe pneumonia. As the treatment is short, even at high dose, corticosteroids are not associated with serious side effects. Potentially higher blood glucose levels are temporary. Prolonged use, that is, used for more than 2 weeks, may be associated with adverse events such as glaucoma, cataract, fluid retention, hypertension, psychological effects, weight gain, or increased risk of infections and osteoporosis. Psychological effects being mood swings, memory issues, confusion, or irritation. Is dexamethasone available across the world? Yes, dexamethasone is off-patent and has been marketed in different formulations, for example, tablets, liquid solution for injection, for many years. It is generally available in most countries. There are several manufacturers of the product. One manufacturer had already been pre-qualified by the World Health Organization, which is Kern Pharma in Spain, while another is under assessment. The most common formulations are tablets, which contain 0.5 milligrams, 0.7 milligrams, and 1 milligram. Oral solution, which contains 0.5 milligrams per 5 milliliters, 0.5 micrograms per 5 milliliters, 20 micrograms per 5 milliliters, and 1 microgram per 1 milliliter. Injectable suspension, 4 micrograms per milliliter, and 20 micrograms per 5 milliliters. In recent years, there have been occasional reports of shortages of this product. It is important to quickly understand the projected volumes for COVID-19 utilization and manufacturing capacity to help assess the impact for existing indications and the potential need for substitute therapies to ensure all patients retain access to a safe, effective, quality, affordable product to meet their therapeutic needs. So, the next treatment is vaccines. One vaccine is Pfizer by BioNTech. On 2nd December, UK regulators granted emergency use authorization to a vaccine from drug firms Pfizer and BioNTech. The name of that vaccine is BN2-162b2. The number of shots are 2 shots with 21 days apart, and it is shot in the upper arm. This type of vaccine is an mRNA vaccine. So what are mRNA vaccines? mRNA vaccines are a new type of vaccine to protect against infectious diseases. To trigger an immune response, many vaccines put a weakened or inactivated germ into our bodies. Not mRNA vaccines. Instead, they teach our cells to make a protein, or even just a piece of protein, that triggers an immune response inside our bodies. That immune response, which produces antibodies, is what protects us from getting infected if the real virus enters our bodies. So, first, COVID-19 mRNA vaccines are given in the upper arm muscle. Once the instructions are inside the immune cells, the cells use them to make the protein piece. After the protein piece is made, the cell breaks down the instructions and gets rid of them. Next, the cell displays the protein piece on its surface. Our immune system recognizes that protein doesn't belong there and begins building an immune response and making antibodies, like what happens in natural infection against COVID-19. At the end of the process, our bodies have learned how to protect against future infection. The benefit of mRNA vaccines, like all vaccines, is that those vaccinated gain this protection without ever having to risk the serious consequences of getting sick with COVID-19. The possible side effects from these vaccines is in the arm where you got shot, so pain, there could be redness, and there could be swelling. And throughout the rest of the body, there could be tiredness, headache, muscle pain, chills, fever, and nausea. So how well does the vaccine work? Based on evidence from clinical trials in people 16 years and older, the Pfizer-BioNTech vaccine was 95% effective at preventing laboratory-confirmed infection with the virus that causes COVID-19 in people who received 2 doses and had no evidence of being previously infected. In clinical trials, the Pfizer-BioNTech vaccine was also highly effective at preventing laboratory-confirmed COVID-19 infection in adolescents 12 to 15 years old, and the immune response in people 12 to 15 years old was at least the strongest immune response in people 16 to 25 years old. The vaccine was also highly effective in clinical trials at preventing COVID-19 among people of diverse age, sex, race, and ethnicity categories, and among people with underlying medical conditions. Evidence shows mRNA COVID-19 vaccines offer similar protection in real-world conditions as they have in clinical trial settings, reducing the risk of COVID-19, including severe illness by 90% or more among people who are already fully vaccinated. A small number of people have had a severe allergic reaction called anaphylaxis after vaccination, but this is rare. Anaphylaxis can occur after any vaccination. If this occurs, vaccination providers have medications available to effectively and immediately treat the reaction. After you get COVID-19 vaccine, you will be asked to stay for 15 to 30 minutes so you can be observed in case you have a severe allergic reaction and need immediate treatments. So, are there any long-term side effects? Serious side effects that could cause a long-term health problem are extremely unlikely following any vaccination, including COVID-19 vaccination. Vaccine monitoring has historically shown that side effects generally happen within 6 weeks of receiving a vaccine dose. For this reason, the FDA required each of the authorized COVID-19 vaccines to be studied for at least 2 months after the final dose. Millions of people have received COVID-19 vaccines, and no long-term side effects have been detected. If scientists find a connection between a safety issue and a vaccine, the FDA and vaccine manufacturer will work towards an appropriate solution to address specific safety conditions. So, another treatment for COVID-19 is oxygen therapy. The SARS-CoV-2 virus, in many cases, targets the respiratory system, leading to an inflammation of the lungs. In severe cases, this may lead to hypoxemia, which is the leading cause of death among COVID-19 patients. A blood oxygen saturation level, SpO2, above 95% is a healthy range for children and adults. Oxygen saturation levels below 90% are considered dangerous. According to the World Health Organization, about 20% of COVID patients will require oxygen therapy to prevent respiratory failure. So, oxygen can be administered in a variety of ways. For low to moderate oxygen deficiencies, patients can be put on either a nasal cannula, a medical tube that goes through both nostrils, or on a simple or reservoir face mask. In these cases, 1 to 15 liters of oxygen per minute is delivered to supplement a patient's regular breathing. If higher volumes of oxygen are required, patients may then be placed on a high-flow nasal cannula, a continuous positive airway pressure machine, or a ventilator. In these cases, up to 100% of the oxygen of a person inhales comes from the oxygen cylinder. So, continuous positive airway pressure. If breathing extra oxygen isn't enough to improve the oxygen level in the blood, oxygen under pressure can be used to help the movement of gases in and out of the lungs. This is given via a tightly fitting mask connected to a machine via plastic tubing. The patient remains awake, and doctors can control the pressure and amount of oxygen delivered by the machine. However, this treatment requires large quantities of oxygen, which may be limited in hospitals that are treating large numbers of COVID-19 patients. It may also create virus aerosols, putting healthcare workers at risk. Staff therefore require high levels of personal protective equipment with suitable masks.
In this section, we will be going through each of the highly affected countries, what they have in common, and how their analytics show the progression of the pandemic.
Okay, so there were multiple reasons for the bad outcome COVID had in Spain, some of which were the poor governance of the crisis, the lack of preparedness, and the slow and delayed response. As well as this, Spain has a significantly older population, which is more vulnerable to disease. 19.1% of the population are 65 years or older. They also have a very social way of life compared to other countries, which would also increase the spread. Spain's healthcare system was weakened by a decade-long financial crisis in which funding of healthcare was being cut down every year, and COVID exposed this. The government was really slow and basically ignored the rising cases in the first week. They were criticized for not acting earlier and not stockpiling medical equipment when conditions deteriorated in Italy throughout February. The Minister of Health even stated that in Spain there is no virus, the disease is not being transmitted, and there are no cases. Even after the cases were rising, he said there is no need for social distancing. The government allowed massive demonstrations to take place, like the International Women's Day, where 120,000 people gathered in Madrid. All of this propelled the spread of the virus in the city. Only after Spain recorded 2,218 infections and 54 deaths did the government announce that they were declaring it a state of emergency. The number of cases and deaths doubled every day since then. There has been just under 81,000 deaths, 3.8 million cases, and 150,000 people have recovered. Okay, on to Italy. The virus was first spread to Italy on the 31st of January, with the first death being on the 22nd of February. On the 8th of March, the Prime Minister expanded quarantine to all of Italy, placing over 60 million people in lockdown. All commercial activity and non-essential businesses were closed until the 3rd of June. However, in October, Italy was hit by a second wave, and now Italy has around 170,000 active cases, which is one of the highest in the world. There was a concrete threat due to lack of ventilators, hospital beds, and healthcare professionals, and hospitals were past maximum capacity. On March 27th, 2020, 969 people died in 24 hours. The Italian healthcare system is generally efficient, however, it varies across regions. Expenditure for preventative services targeting individuals like immunization and screening has increased over time. Now onto the US. Although they did successfully provide a surplus of ventilators, they still had a lack of hospital beds to treat patients. New York would need around 110,000 hospital beds, but only had 53,000. There was also a huge lack of PPE supply. The government tended to overhype their successes greatly. During the pandemic's early days and weeks, President Trump and other authority figures actively minimized the virus's threat and dismissed it to be no worse than the flu, and said that the pandemic would be over by Easter, and the people followed this. There was a slow and flawed testing and inadequate tracing, isolating, and quarantines, along with the confusing guidance with masks. American citizens grew restless quickly, and anti-maskers and anti-vaxxers increased.
As well as the devastating COVID pandemic in India, some parts of the nation are struck with black fungus, which is also known as mucormycosis, an epidemic, which has been proven to be fatal. Many of those being infected from coronavirus patients, or those who have recently recovered from COVID-19, whose immune systems have been weakened by the virus or have underlying conditions, most notably diabetes. This becomes a problem when presented with the fact that India has an estimated 77 million people with diabetes, which makes it the second most affected in the world. Although cases are minor compared to the pandemic, around 2,000 locally, 9,000 around the country, it is a very important topic to discuss, as most deaths happen with those who have recently had coronavirus, and hence it is important to highlight the need to maintain safety and protection even after being dispatched from hospital. To back this up, a study in 2005 looking at the cases of black fungus pandemics in the last century found it to have a 50% or more mortality, making it very deadly, and even deadlier if the patient has underlying conditions or a weakened immune system. Another study suggested that mucormycosis is 70 times more prevalent in India health data than the rest of the world. Furthermore, the contraction of black fungus can lead to a loss of eyesight, necrosis of the skin and bone, most notably of the face, hence the black name. Although the government made an effort to educate people of how to keep themselves safe, a population of over 1 billion people is difficult to manage. A lack of population distancing, a lack of financial aid, and general education led to many simply ignoring the disease and going about wearing masks for the sake of it, taking them off to discuss with one another, not fully understanding the consequences of doing so. This caused Prime Minister Modi's ratings to drop as the second wave grew more, coupled with a lack of vaccines, leading to more government attention. 30.7 million cases are present and rising, with over 407,000 deaths.
From the 3rd of January 2020 till present, there's been almost 19 million cases in Brazil and over 500,000 deaths. Brazil is notably, as it is among one of the many governments, have received much criticism over their handling of the pandemic. Brazil has been one of the most hard hit for a number of factors. Many risk groups are present in the country, lack medical support due to economic instability and public hospital overflow, temperate climate with high pollution levels, hence higher disease progression, low academic understanding of COVID-19 virus and lack of effective rules. On March 29, 2020, Members of the government visited public places, mitigating the measures stipulated by the Minister of Health. Also, the government introduced as a campaign measure the hashtag "O Brazil Now Pode Parar", hashtag Brazil Cannot Stop. The campaign was removed from the official media, and the government denied the disclosure of the advertisement. An article from the BBC states Professor Halal, who had lost several friends, says his country has been a laboratory for everything that could have got done wrong in the pandemic. The result, according to his research, is 400,000 deaths that could have been avoided, a quarter of them caused by a failure to sign vaccine contracts last year. This could have been due to the unscrupulous comments and actions made by President Bolsonaro, saying vaccines cause damage, lockdowns are tyrannous, refusing to buy millions of vaccines, and multiple other things.
Okay, so now we're going to move on to ethics. A patient named Sonia De Leon, who had suffered from schizophrenia, had died from a heart attack after contracting COVID-19. She had a DNR order in place, but though her family had apparently been told about the order, they said that they received no consultation and claimed that if they were told about the order originally, they wouldn't actually allow it. There have been more than 500 cases where DNR decisions were made without consent from the patient or their family during the pandemic, and this breaches patient rights and breaks protocols. And in order to prevent similar scenarios like this happening in the future, an oversight group was recommended for healthcare providers with the anticipation of a future of optimum care planning, staff training, and precise records of decisions agreed between patients and doctors. Palliative care, also known as end-of-life care, is a support for patients that is often mistaken to be only relevant for people who are close to the end of their life, but it's also quite essential for patients with life-threatening illnesses for the relief of suffering. During the COVID-19 pandemic, the demand for palliative care access had actually risen. However, the access itself was still quite limited, with certain restrictions being in place due to the virus. One of which included distancing regulations to slow any disease transmission. This unfortunately meant that patients who passed away from COVID-19 and were put into palliative care beforehand weren't actually able to have their various preferences put into place, including seeing loved ones. Moving on to hospital beds. So obviously bed occupancy can not actually be more than 100% since hospitals would be able to won't be able to operate, and so spare bed capacity is crucial for ensuring patients are able to flow through a health system. Generally, peaks in bed demand are common and can occur at different times, and hospitals have a sufficient number of beds to accustom to these rises. But because of safety during COVID, the hospital capacity was recategorized, so patients suffering with COVID were treated separately from people who didn't have COVID. Resulting in a large decrease of staff and bed availability within the hospital. And this leads to loads of health system problems, one of which involves more delays in A&E. And others include having no choice but to place patients in the incorrect wards, which leads to an increase in infection rate as well. The NHS also wrote to trusts in March of 2020 to discharge all patients which were medically fit to be discharged and postpone any procedures that weren't urgent. And this was apparently to relieve any increased capacity and make way for potential future COVID-19 situations. And this then leads to delaying treatments as well. The crest of the COVID-19 pandemic was when most surgeries and outpatient appointments had to be stopped or delayed. Many patients with very life-threatening conditions like cancer, kidney disease, stuff like that, were severely affected by interruptions with healthcare services they needed, like screenings. There have also been problems with NHS waiting lists, even before the pandemic. And the NHS struggled to meet demands for its services and often didn't succeed in reaching any targets in performance. Over 4 million people were on the waiting list for routine health procedures during the pandemic, and the waiting list was expected to increase considerably. The main psychological impact during the pandemic, besides stress and anxiety levels, was the fear of actually contracting the virus. And this causes people to face a restriction of their movements in their home in order to avoid or slow down the spread of the disease, affecting daily life, essentially. The new lifestyle changes like working from home or school or just having temporarily unemployment involves a great shift in attitude and daily routine, affecting mental health even further. And due to loneliness, levels of depression and drug abuse, they have been increased as well because of loneliness as well. The survey on 4,000 students showed that more than half of them believed that their mental health had declined during the pandemic. Less than a third of them actually reached out for help. And though universities claim that they've kept campuses safe and looked after students the best they could, more counselling and wellbeing services have been suggested to potentially improve the mental health of young people during the pandemic. Okay. Thank you for listening. Sorry.
No worries. Are there any questions? Feel free to ask questions on Slido or unmute your mic. We'll have the references at the back, and we'll try and make this presentation available on the website itself. So feel free to unmute your mic, ask any questions to either of us or the whole committee. Okay, since there's no questions coming in, so can I let the first person to introduce, or Trudy to introduce the debates?
Yeah, okay, so we have Group 1 and Group 2, who will be debating for and against the statement, the UK and NHS dealt with the coronavirus pandemic well. Please welcome the opening proposition from Group 1. Good luck.
Good morning, ladies and gentlemen. I would like to commence today's debate by defining the motion. The UK and NHS dealt well with the coronavirus pandemic. By the UK and NHS, we are referring to the government and the National Health Service provided by the government. Additionally, by the term well, we mean that the UK and NHS has successfully minimised the dramatic and inevitable effects of COVID-19 by reducing the number of cases and consequently deaths due to the coronavirus, as well as reducing the effect that COVID-19 has had on our economy. There are several points which will be covered by me and my colleagues during this debate. I will be focusing on the social distancing measures and early guidelines imposed by the government at the start of the pandemic. I will then be highlighting the success of the NHS test and trace system introduced by the government. Following this, I will discuss the launch of lateral flow testing through LFDs, which are lateral flow devices, which have experienced a great victory in identifying asymptomatic cases of the coronavirus throughout the UK. My colleague, the second speaker, will then be discussing the vaccination programme rolled out by the government beginning in December of 2020, as well as a furlough scheme implemented to help workers both employed and self-employed throughout the pandemic. During the beginning of the pandemic, the government introduced certain guidelines, such as maintaining a 2-metre distance, as well as washing hands regularly. The 2-metre distance stops COVID-19 bacteria from being able to transfer and thus spreading the virus. It is clear that the nearer you are to someone who is infected, the greater the risk of catching the virus. Furthermore, the guidelines of regularly washing and sanitizing hands are essential to reduce the spread of COVID-19, as scientists have stated that transmission of COVID pathogens is most strongly associated with close and prolonged contact, and this suggests that close-range direct person-to-person transmission, basically droplets, and indirect contact transmission via surfaces and objects are the most important routes of transmission. This conclusion further proves the logic behind the government guidelines, as well as the success of social distancing and maintaining strong hygiene, as it has significantly reduced the spread of the coronavirus. Additionally, on the 27th of July 2020, face coverings were made mandatory on public transport by the government, and this was a key point in the reduction of the spread of COVID-19. Yeah.
How was this unique at all to the UK and NHS, considering pretty much everything mentioned was adapted by pretty much every single other country in the world at around the same time?
Well, I think that there are certain guidelines which have to be implemented by every single government, and just because that everybody else is doing it, it doesn't mean that the UK can't do it. The UK government can't do it. We're not necessarily competing with the rest of the world. We're simply trying to reduce the number of cases and reduce the number of deaths. So although this may not have been unique to the UK government, it was highly important and highly successful, as proven through the statistics that will be mentioned throughout my speech. Thank you. Face coverings becoming mandatory in all public places was critical for reducing the spread, as we know that it is the spread that COVID-19 is spread most easily through droplets and close contact. Face masks are also very important, as they lessen the chance of spread in places where social distancing is perhaps not possible, such as in schools or on public transport. The NHS test and trace system has achieved great success in the UK. The system requires people who have tested positive for COVID-19 to provide all of the people that they have been in close contact with in the last 2 weeks. Subsequently, the NHS test and trace system will contact those close contacts and instruct them to self-isolate for 14 days, and this later reduced to 10 days. The accomplishment of the NHS test and trace system has consistently been proved through statistics such as 87% of people provided details of a close contact, and 93% of those contacts were identified and then asked to self-isolate. The instruction to self-isolate for close contacts is highly efficient, as it reduces the chance of close contacts who potentially have COVID of transmitting the virus by going outside and unwarily and unintentionally spreading COVID-19. Additionally, the development of lateral flow devices and consequently lateral flow testing by the UK government has further highlighted how well the UK government has dealt with the coronavirus pandemic, as it enables asymptomatic cases to be identified. These lateral flow devices, the tests are 99.9% accurate and can be as high as 99.97% accurate, with the chance of false positives being extremely low. So the rapid results are also very useful. Yeah.
Okay, so you've said you've given these things that they've done, but what's your measurement of the success? How clearly can you tell the what is the absolute value of the successes you've given? You're kind of just describing. Could you clarify?
Yeah. Okay. The statistic is that 9% after the introduction of lateral flow testing, the cases reduced by 9%, as 14,386 cases were identified as like 18. Yeah.
Wasn't the lateral flow test made in China, not the UK?
No, when they were started using in the UK, not when they were introduced to the world. So additionally, the week where bilateral flow testing was introduced, saw a reduction in the number of cases by 9%, as positive cases who perhaps would not have been identified without lateral flow testing, as they may not have been experiencing symptoms, were identified and instructed to self-isolate, thus reducing the spread of the coronavirus. To conclude, the UK has dealt with the coronavirus pandemic well by introducing social distancing measures, which have consistently been proven to reduce the number of COVID cases. Additionally, the NHS test and trace system has reduced the number of COVID-19 cases by 9%, as I said, by instructing close contacts of positive cases to self-isolate and then finally, lateral flow testing, which has been provided to schools, places of work, and households, and these lateral flow devices can be collected from all local pharmacies, and obviously students will have access to these lateral flow devices from schools. They have also been helped to identify cases of COVID-19, and all of these points prove how well the government has dealt with the coronavirus pandemic. Thank you.
Okay, cool. Thank you to group one. Next, we have group two with the opening opposition. And by the way, we encourage cameras on, please. Good luck.
Can you hear me? Okay. Okay, good morning, ladies and gentlemen. Today I'll be standing by the side of opposition, debating how UK and the NHS has not dealt with COVID-19 pandemic so successfully, and giving reasons of why. But firstly, I'd like to give some rebuttals to the opening speech. So the first opening, the opening government has mentioned about COVID-19 bacteria, which in fact is a virus. How UK has dealt with it well by giving out measures in the beginning of the pandemic, such as 2 meters social distancing, washing hands regularly, which were not really UK's measures. It was really like given by WHO's guidances, and this was followed by every other country. So I don't know how the opening government thought that this was UK's government guidance, which was unique to UK and which made it successful. What I think was successful for the dealing of pandemic by countries is the efficient lockdown measures, track and trace, and clear transparency, not regular guidances which were followed by every other country. And the opening government also mentioned about lateral flow test. However, this was introduced much later, in the much later stage of the pandemic, after the excess death rates have risen to so high that the ICU, the intensive care units in the NHS hospitals couldn't deal with it anymore. 128,000 deaths and hundreds and thousands of excess deaths. How is that? How is this meant to be? This records one of the highest and worst overall COVID-19 death tolls in Europe, as the second worst excess death tally per capita in the continent, more than double in France and Germany, and a failure or success. I'll leave that to you to decide today. But firstly, I want to talk about the preventative measures given by the government. I want to delve into the what the government measures really were to do with actually tackling the COVID-19 pandemic, instead of just the guidances such as washing hands and 2 meters distancing. Firstly, track and trace. For lots of other countries, the track and trace systems were urged by WHO. They were advised to focus on the track and trace app, identifying and isolating every case and tracking down and quarantining everyone who was exposed to the virus, especially during March and February 2020. However, England's Deputy Chief Medical Officer at that time said that the track and trace was not needed because the WHO stands for World Health Organization, which means that it's meant for other countries with different health infrastructure. And this again shows the misbelief in English exceptionalism and thinking that UK will be fine and do well in measures and will not undergo COVID catastrophes as other countries. However, this has proven wrong when the UK three-strap protocol only came out in November 2021, and when other countries have already taken measures beforehand, such as South Korea, who had 4,000 cases in early March, and the cases decreased to 0 in May 2020, whereas UK, the cases are rising dramatically in May 2020, where ICU units had no longer the capacity to take in any more patients. And my second substantive for UK's failures and measures were the late lockdowns and all the ambiguities that UK government has placed the population in. At the start of the pandemic, UK had no stockpile of PPE, leaving hundreds and thousands of NHS workers highly vulnerable. And not even the population itself, not just the NHS workers, they were warned, they were advised not to wear masks, then suddenly to wear masks. There was lots of ambiguity with PPEs and masks. And despite being warned for years about lack of PPE, and despite being warned about the importance of PPE, even the government, the heads of government, Boris Johnson, Matt Hancock, refused to believe this until the pandemic hit the UK and the death toll started to rise. As Boris Johnson has described in his WhatsApp message, it was totally useless. And confusing lockdown lifts and lockdown shifts, causing people to bulk buy things from the grocery shops, leading to nationwide scale of stress and increased mental health problems in the UK. One of the worst mental health problem increase. The UK was struck by one of the worst mental health problems in Europe, and the public response to the pandemic was just shameful, as marked by journalists in the BBC who said that more than half the UK population didn't know the current COVID guidelines because it was shifting all the time. This again shows how English government has not dealt with the measures well, and didn't think ahead of time for the COVID catastrophes, and placed guidances just within the second that the catastrophe has been brought. Yes, I'll take your point.
You mentioned that we went into lockdown late, but we were actually one of the first countries to go into a full on lockdown, and with like less than 900 cases of a 60 million population. So how do you define that as late?
The UK government has actually dealt with lockdown late, because it's not even just in March 2020 when it has struck UK bad. It was the UK has went to lockdown late because it has seen other countries go to lockdown first before it has gone to lockdown itself. So it's seen Italy, it's seen South Korea, it's seen China, and seen Japan, and UK has not prepared for the PPE and the lockdown measures for it. Or even though it placed lockdown, the lockdown measures were not efficient, and cases were rising anyway. And the UK had recorded one of the worst death tolls in Europe by May 2020, and that again shows how even though the UK placed your lockdown measures, it was not efficient, and it was not quick enough to prevent all the excess deaths that it caused. And this shows, and I remember during 2020 lockdown, in the country's leader, the Health Secretary, Matt Hancock, Prince Charles, loads of people had caught COVID, and hundreds and thousands excess deaths has been caused by the insecure guidances, and this shows that the UK has not dealt with COVID effectively, and the failure of the track and trace was inexcusable. How it only came up in November 2021 when other countries had it early as February 2020. This is so inexcusable, as UK had the time to watch and see how other countries did. It should have adapted and been more efficient in how it came up with measures and track and trace. Thank you.
Okay, thank you for your debate. I'd like to introduce the second proposition speaker from Group 1. Do you have a second speaker from Group 1?
Yeah, she should be joining now. 1 second, sorry.
Okay, sure, no worries.
I'm sorry, she said that she's speaking, and like her mic's on, but I said we can't hear you. She said she's just going to leave and rejoin now. Is there another speaker that can speak in turn of her, possibly, and then we can switch over later? Yeah, I'll ask our third speaker if she can do her speech now.
Hi, I think I'm the third speaker, so I guess I'll begin my speech now. Okay. To start off my speech, I'd like to begin with a few points of rebuttal, and then I'll move on to my main points, and I'll be talking about how the UK had a successful vaccination program, the success in how the UK managed the NHS resources and the main aims of the government and what they wanted to achieve, and a few of the policies that the UK ensured to keep in place for the pandemic. So my first point of rebuttal to the previous speaker would be that opposition has claimed that, the UK just followed social distancing because it was forced upon because of the WHO. However, the UK government was a lot more strict about social distancing policies and even put fines on people if they didn't follow it. And actually, there were no, thank you, and it's protected time. And there were many countries that actually weren't as strict on social distancing policies, and the government didn't do anything about it if they broke the law, and they didn't really put any fines. However, the UK, as I said, were a lot more strict, and they regulated it in different parts of, say, England, and at regular stages based on how bad the pandemic was, they changed the social distancing policies based on that so that everything could still be efficient. So you can't just say, oh, the UK just followed WHO, because actually the UK was a lot more efficient with it than other countries. And my second point of rebuttal was that the UK had a bad organization.
POI?
No, thank you. That the UK had a bad organization with its PPE. Yes, initially it did have bad organization with PPE. However, it later improved, and many countries had PPE problems. It wasn't just the UK. And like I said, no thanks. And it later did improve, so it's not as big of a problem as we think. And finally, my final point of rebuttal before I launch into my points is that the UK went into lockdown late, claimed by opposition. However, like we addressed, the UK went into lockdown quite early. We went into lockdown on 16th of March 2020 when we barely had any cases. Therefore, we actually did go into lockdown quite early. And if we hadn't gone into lockdown, there would be a lot more deaths as of now. So this is incorrect. Moving on to my first point, with how the government hasn't had any experience before and has only ever dealt with epidemics before, such as foot and mouth disease, and the previous kind of example to any kind of extent of this massive pandemic is the Spanish flu in 1918, which doesn't even measure to what governments all across the world have had to deal with. Therefore, you do need to take into consideration that there's never been a pandemic before of this, no thank you, of this kind of scale before. So the UK government, considering that, has done quite well. And in spite of unprecedented natures of this global pandemic, the Scientific Advisory Group of Experts, also known as SAGE, quickly processed the data based on other countries' experiences and advised the governments on policies. And the government took the scientific data into account and formulated policies, like mentioned by the first speaker, about lateral flow testing, social distancing policies, and what happened with schools. And they used this to tackle different impacts in the UK. And these policy decisions were regularly communicated to the public by daily press briefings and on TV and the news, with political leadership, scientific advisors, and other relevant chiefs, such as NHS chiefs or experts, so that the public understands the pandemic and cooperates with government policies, which was a crucial part in fighting this pandemic. No, thank you. Now, moving on to my second point about how the NHS managed their resources. There was routine clinical activity, and surgeries were cancelled so that medical staff, like doctors and nurses, were redeployed for caring for COVID patients, and emergency hospitals were also built on short notice. For example, the Nightingale Hospital in England and the Dragon's Heart Hospital in Wales. No thanks, to create extra capacity for patients. However, patients with cancer or urgent medical conditions weren't compromised, and care still continued for those. Even the military was mobilized to help with building emergency hospitals and manage supply of medical equipment and PPE, and many other countries didn't use their military. However, the UK did, which was yes, accepted.
You said that patients' health weren't compromised when doctors were moved from routine surgery onto COVID care. However, this is a completely false statement, as both routine surgeries as well as certain cancer treatments are completely cancelled and delayed up to 12 weeks. How could this be true?
Thank you for your POI, but however, urgent care patients were still taken care of, and yes, some patients were pushed back, but that happened in many countries, and critical care patients were still taken care of. Okay, and moving on to my point. So an emergency medical equipment like ventilators and PPE were obtained from local manufacturers and international suppliers at short notice. And the government even negotiated with companies such as Dyson to manufacture ventilators. No, thank you. And a lot of other industries and other areas that aren't even related to medical equipment manufacturing, for example, like alcohol industries, were asked to manufacture hand sanitizers or emergency equipment, showing that the UK used all of their resources.
POI.
POI.
No, thank you. And you can only offer a POI after 15 seconds. Also, so moving on to my second point about how, many people in the NHS frontline staff workers were selfless and caring toward their colleagues and showed great amounts of empathy and sacrifice. And actually, currently more than 45.6 million people in the UK have received at least one dose of coronavirus vaccine, and is the part of the biggest inoculation program the UK has ever launched. And in fact, the UK has gotten coronavirus jabs in people's arms faster than any other country in Europe, and has been extremely efficient with vaccination cases. And because the UK's first advantage was getting going early, since the country's drugs regulators, the MHRA, was the first in Europe to approve the Pfizer vaccine back in December 2nd, weeks ahead of the European medicine agencies, which opened the doors to nearly 1 million doses of that jab manufactured in Belgium being delivered to the UK by the second week of December. And after that, the MHRA authorized the vaccine developed by the University of Oxford and the AstraZeneca, and a third, which was the Moderna vaccine. And these prompt decisions were possible because the UK changed national medicine regulations in the fall to enable the MHRA to give temporary authorization to a vaccine that meets safety and efficacy standards, but has yet to finish the licensing processes. However, the EU didn't opt for this, so that's why there were more cases in certain EU countries, such as France. But the UK didn't do this, which was good because we had less cases than them. Also, the UK even announced that they will donate 100 million coronavirus vaccines to the world within the next year to countries in need, which is very important. And Kate Bingham, the chief of the government's vaccine task force, between May and December, had early conversations with vaccine producers, getting ahead of the EU in the first few weeks of the vaccination race. And by mid-August of 2020, Britain even signed in principle arguments securing all types of coronavirus vaccines. And since the UK had clear vaccination delivery plans, because in February 2021, the government set itself a target to vaccinate 14 million people in those in priority groups, and those priority groups made up 88% of the deaths, which is why they focus on priority groups. And overall, the UK had large vaccination networks. They used the military. They became one of the first countries to devise a communications campaign to tackle with misinformation about people taking the vaccine and skeptics. And it was easy to book appointments in comparison to other countries who struggled. Therefore, the UK managed the pandemic very well in comparison to other countries. Thank you.
Thank you for your debate. I'd like to introduce the second speaker from the opposition.
Can you hear me?
Yeah.
Cool. Yeah, 1 second. Let me get my notes up. Oh, shall I start? Okay, I'll start now. So thank you. I'm going to start my speech off with some light rebuttal. The last speaker talked about, hang on. Okay, so talked about local manufacturers and the procurement of PPE. So first of all, they said that they've given advice. However, the UK government was warned for years about not having a good enough stockpile of PPE, which they didn't do anything about. And then when the pandemic hit, of course, they were short supply. I don't really see how doesn't, just because after the fact they managed to get PPE, doesn't really show a good enough response, because what would be better when the PPE was needed, so there wasn't a short supply, that they got the PPE. This brings me on my first point about basically the various PPE scandals. At the start of the pandemic, as previous speakers have said, the UK had no stockpile, and leaving hundreds of thousands of NHS workers highly vulnerable, and this would also would have had yet left patients vulnerable as COVID spread through hospitals. But millions of items of PPE that they did get were just disappeared, and government statistics about how much PPE had handed out were also extremely misrepresentative. They said they had handed out 1 billion pieces of PPE, but they ended up counting individual rubber gloves in that count. This put both patients and healthcare at risk, two of the most important groups to protect during this pandemic. The NHS workers are putting their lives on the line at this time, and they're not even being kept safe. But then when let's talk about then the UK government of getting out PPE. The UK government notoriously handed out contracts worth tens to hundreds of millions of pounds to several companies which had no employees and no past experience in developing PPE. So this is just such a blatant cronyism during a time where the UK really needs support and strong leadership. We just have a failure to meet this. The opposition also brought up Dyson. Now, Dyson ventilators were never used. They were of very poor quality, and the demands Dyson made was that he would get tax breaks, and also he could import workers from Southeast Asia, which would work for much cheaper, to produce it. And he also had no experience in making PPE or medical equipment. This is just once again. It's just cronyism and not really the sort of leadership and support we need to see. This brings on to my next point about the lack of material support from the government for the NHS. For the past 10 years, conservative austerity has gutted most public services, including the NHS, which left, once the pandemic hit, this is all exposed. We don't have enough resources. Pay for these doctors is low. There are in the NHS as a whole is vulnerable, not enough beds, not enough ICU staff, not enough ventilators. Of course, they ended up building hospitals, but this is once again, these are too late. With a lot of these solutions, similar with the lateral flow tests that were brought up earlier, these are brought in far too late when their other track and trace system just didn't work. So the statistics the opposition gave were quite cherry-picked, and they aren't really looking at the larger picture about care homes and other things. Yeah, is there anything else? Okay, now some points about vaccines that the opposing team brought up. The way vaccines are development in terms of how governments fund it is that it's a gamble about where they invest. Okay, they will invest in certain research groups, and sometimes they will fail. For example, Australia invested in a vaccine which didn't pan out. However, Australia also had primary prevention methods. So they had really strict lockdown procedures, so they didn't cause an issue. In the UK, we could have also avoided that by having lockdown that was strict and earlier. Claiming that we'd locked down, were one of the earliest to lock down, isn't really a strong enough point when far too many other countries were taking stricter measures. We could see who had experience with dealing, more experience, and were more adept, proactive about preventing these pandemic. Politicians during the time were seriously downplaying it, with Boris Johnson saying things like "take it on the chin." This doesn't create sort of national morale and sort of mindset that's needed for tackling a pandemic. It's quite the opposite, in fact. So with the vaccines, about not dealing with the EU, it seems that was simply related to Brexit policies. Once again, is luck. A lot of the points that the opposition have brought up were chance and luck, and not really proactive and taking initiative from government. Okay.
As the opposition, we were saying that the UK had more vaccines than European countries and vaccinated a lot more people, therefore their cases dropped a lot sooner. It's nothing to do with Brexit. It's just to do that the vaccination program was more effective in getting more vaccines to people.
No, but for example, the program, right? Because otherwise it would have been a unified program if they worked with the EU. The reason why they weren't working with the EU seemed very close, Brexit tensions. And it's not really demonstrative of initiative from the UK government and NHS. Earlier, I brought up how the NHS workers were kind of left, with the lack of support for the NHS. And instead of providing a lot of support, the media started presenting NHS workers as heroes and these clapping. This is like completely symbolic and didn't actually, once again, was not a proper solution to any problems. It wasn't a material solution. It was just a sort of, we're appreciating the NHS without actually giving them the proper support they needed. So I'm going to wrap up my speech now. So first of all, a lot of the points that the opposition have brought up have been challenged and not really special to the UK. A lot of these guidelines were general, and the implementation of them were weak and the economic impact that this has caused, instead of hard restrictions at first and then a small recession, then we have drawn out this economic recession over a month, and the damage has been catastrophic, which is going to obviously have more effects onto taxes, onto funding for these services. It's just a sort of multiplier effect. When it comes to the actual procurement, the government has not been effective. They have been weak-handed. They have not. They've been corrupt in places, and so I don't see in any respect how they can be considered to be actively successful in dealing with the pandemic. Thank you.
Thank you for your fine speech. Can we introduce the originally second speaker from the first debate?
Hello, can you hear me now?
Yeah, that's great.
Okay. Apologies for earlier, I wasn't sure what's happening. So firstly, I would like to talk about how, in fact, the government did support the NHS during the pandemic. So the people of the UK owe a lot to the NHS and its brilliant staff who, throughout the pandemic, drew deeply on their professionalism, skills and training, and they did the very best for patients. The government did step in during this time, providing £3 billion in funding to support the NHS in England during winter. And they also funded the devolved administrations. This allowed for an expansion in capacity to support both COVID-19 and non-COVID-19 patients by using the independent sector and the Nightingale hospitals to ensure smooth operation of the NHS. Additionally, thanks to the government's effective recruitment and returning staff, last year the NHS workforce increased by over 48,000, including over 25,000 professionally qualified clinical staff. They also put in the measures needed for 23,000 nursing students and 3,800 medical students to support their colleagues on the front line in England. This helped to protect non-COVID-19 services, such as cancer services, urgent elective surgery and diagnostics, as far as possible. Despite the high levels of COVID-19... No, thank you. The NHS in England carried out more than 80% of the elective treatments in December 2020 compared to the previous year. So whilst the elective care waiting times have increased for some patients, even during the highest period of pressure during the pandemic this winter, the NHS had brought average waiting times to 40% lower than the summer. The government has also said that they will continue to work with the NHS to ensure that it has what it needs to deal with the impact of COVID-19. The government has also said that they are committed to ensuring that the NHS continue to have comprehensive emotional, psychological and practical support that they need, and they will have PTSD help once the pandemic calms down a bit. No, thank you. The UK's government's overriding goal is to protect the lives and the livelihoods of citizens across Scotland, Wales, Northern Ireland and England for the whole benefit of the UK, and they have secured access to more than 400 million doses of the vaccine. They have established the largest testing infrastructure in Europe, provide unprecedented levels of financial support for business and individuals. No, thank you. Vaccines are at the heart of the UK government's strategy to manage COVID-19, and they're deploying the most ambitious vaccination programme in history. By 15th of February, they were able to give the first dose of the vaccine to the 4...
POI.
No, thank you. to all of the 4 most vulnerable cohorts identified by the Joint Committee on Vaccination and Immunisation. This included the elderly care home residents, those aged 70 and over, those with conditions that would leave them clinically extremely vulnerable to serious illnesses and death as a consequence of COVID-19, as well as the frontline health and social care staff. And by the 31st of July, they're hoping that all adults aged 18 and over would have been offered their first dose, which is pretty incredible. In addition to this, the furlough scheme is something the UK government has also enforced and has extremely helped the workforce. They predicted that 1 in 20 people employed would lose their jobs, but because of this scheme, this has now been reduced to 1 in 10. As well as, allowing people to keep their jobs, it has also allowed businesses to be given more time and headquarters to plan what their future looks like whilst the pandemic consistently changes the way that the workforce is operating. It has also allowed for many people to keep their jobs and protect businesses from making their employees redundant simply just because they don't have the funds to keep them. By spring 2021, 9.9 million jobs were saved in the UK, and the government has not only just provided the furlough scheme, but also a wide range of loan schemes, business grants, tax cuts, welfare support, kickstart and restart programs. No, thank you. Although they acknowledge that the furlough scheme is something that cannot be, going on for eternity, they have also allowed for training and development of skills for those who may want to acquire jobs in different fields due to the effect on their workforce because of the pandemic. So the success of the vaccination rollout, alongside falling infections and hospitalisation, is paving the way for a safe and gradual lifting of restrictions. It means that fewer people will get COVID-19 and that those who do are far less likely to go to the hospital or to die. However, we know that no vaccine is 100% effective, and there are a lot of anti-vaxxers and people who deny the vaccine for different reasons. However, the government is able to take a cautious approach to easing lockdown, guided by the data, in order to avoid a surge in infections. No, thank you. That would put unsustainable pressure on the NHS. Yeah, I think that's it. Thank you.
You still have 2 minutes. Is there anything else you want to say? Okay, I'd like to introduce the final speaker from Group 2 then, who will whip the speech up. So thank you.
Thank you. So I'll be speaking for Group 2, and my main point here would be obviously the death count, and in particular death count per capita, and it used as an aggregate measurement for the success of government's failures here. However, first I'd like to start with some slight rebuttal. So throughout this debate, the opposition has kind of sounded like, government propaganda. They said success is not relative; it's absolute. In fact, this was a response to my first POI from the first speaker. You cannot compare the British success to other countries because it's not relative. Success is from it's from the government diverting deaths, which is a fair statement. However, they contradict themselves straight away when rebutting others on locking down or PPE equipment. When questioned on this stuff, they compare the UK to other nations when it's exactly what they told me not to do. And this was done on UK locking down early, PPE procurement, as well as routine care pushback. When questioned on these things, such as the NHS cancelling routine appointments and cancer treatment, they said, well, other nations did it. Why, you just told us to not compare to other nations. What is going on there? I don't know. It seems like a mess. Moreover, they mentioned Dyson ventilators being, like a flagship example of how the UK, used its, great intuition and ambition to save, the lives of the United Kingdom. They forget to mention that not a single Dyson ventilator was ever used because Dyson ventilators came too late and were simply not strong enough for coronavirus. They were literally never used. Nightingale hospitals, again, faced a similar situation. They were, yes, deployed, however, again, they were rarely used. The one near me, the one in Bristol, in Ashton Gate, they only ever had about 50 people go in. It's ridiculous. And the fact that they stressed the point as if it's such a grand plan is a ridiculous proposition. Finally, they also said that the vaccination program was the most ambitious in program history. So the most ambitious vaccination program in history, quotes there. They continue to tell on a story about, how it unfolded, and what really backing up their assertion about how it was genuinely the most ambitious in history. They instead only looked at the vaccination program in isolation, when the statement implies it was the best compared to all others which has come before it. That is a ridiculous statement. What about smallpox? Smallpox was, was defeated by, our ingenuity through vaccines, and we completely eliminated it from the world. That's never going to happen with coronavirus, and anyone who says so is simply delusional. Now, on to my main point on the death count. The death count is simply, and especially death counts per capita, is the most important measurement in the whole debate. Why? Because it encapsulates all the successes, which the opposition will mention, and all the failures, which we will mention, into one aggregate figure, which we can all agree on, which is indisputed. Think about it like this, right? Coronavirus is like a force, pushing the death count higher and higher and higher and higher, right? Humans have the ability to counteract this force with lockdowns and vaccines and so on, which slow down this force, which and more effective the ones we use, the less the resultant force is, and obviously as a result, the less death count will go up. So death count is essentially the unit of measurement of success, because it takes into account all the preventative actions of the government, of which the opposition has clearly mentioned some, both good and bad, and gives us an aggregate success figure about how good all the measures was. All the earlier factors mentioned earlier by my partners, as well as the opposition, affect the death rate, and slowing it down or speeding it up, no matter what. The death count is undoubtedly the measure of success. For example, vaccines in themselves aren't desirable. Vaccines are desirable because they affect the death count. Now, if you look at death count, the UK is the 20th on the list of deaths per capita in the world. They're beaten only by 7 other developed nations and 13 other developing nations. How embarrassing is that? After 192 UN nations, the UK is 20th, right? Only being beaten by 7 other developed nations. And for 17, every single other developing nation, bar 13, has a lower death rate per capita than the UK. They have a lower success rate. It doesn't matter how good their vaccination programs, it doesn't matter how good their defensive measures are, because this one figure encapsulates all of that, takes all of that into account. And we're 8th on the list, worst of all developed nations in the world. Preposterous. I'll take it now.
You're acting as though UK is like #1 in death capita, but you have to take into consideration that it's not. It's still like 20th or 8th or whatever you said. So it's not as bad as you think. Therefore, the UK did handle it better than other countries.
Right, exactly, and I completely admit that, but it's 20th on the list, and being 20th on the list, it means the UK was worse than every single other developing nation in the world, bar 13. I think that is very embarrassing. One of the richest, most developed nations in the world is that bad. Just because it's #1 doesn't mean we're good. Just, being 20th out of 193 UN nations, the vast majority of which are developing, is ridiculous. That puts us in the top, in the top 10%. I think that's bad. That means if you get 10 countries in the world, 10 random countries in the world, UK would be the worst, even if they're developing nations. That is, I think, ridiculous. And I do not see how the opposition could believe that this would be a good statistic. What they're doing right now is glossing over the fact, saying, oh, well, others are worse than us. It doesn't matter. In fact, they said themselves you can't compare to other countries. It has to be an absolute measurement. I don't think they know what we're doing. Not to mention that the UK was ranked as one of the most pandemic-ready nations in the world by the WHO a few years before the coronavirus pandemic hit. All indications pointed towards the UK having one of the lowest death rates in the world before it actually unfolded, yet we did not. If you could go to Ladbrokes and put on odds on how the UK was going to deal with the pandemic for March 2020, Ladbrokes would give you 500% return, but you didn't, because this government and the NHS by extension had implemented complete failures. But what the opposition has done to paint a rosy picture of of the pandemic is picked specific figures, for every single for every single lateral test distributed, there's been 2 care home failures. They only look at these specific macro objectives, which UK admittedly has done well, but they completely ignore all the other failures. And what I'm doing here is giving you the complete figure, giving the macro picture, the full picture through the death count, because it takes into consideration everything they said, as well as everything they didn't say. So how could it be that that aggregate figures is simply so high? How could the measurement of success be so swayed towards failure? It's simple. It's government failure. The failure to control, the failure to protect, the failure to protect public trust. It's very clear. If you look at the full picture and not just little bits of the response, such as, lateral protests. It's very clear that the overall picture is very, very, very grim. Thank you. I'm done. Good debate.
Okay, thank you very much. Does anybody have any questions for any of the speakers today? Okay, I think I can pass it on to Avril to give any of his feedback that he's after listening to the debates.
Yeah, hi. I think some of you already know me from debate. A few of you recognize your name from Debate Club. So I'll do. I'm going to be giving you first some general feedback, and then if you are fine with that, I'll go through specifics. I won't keep you for too long though, because I know lunch is pretty soon. So I'll explain what I think the motion means. The motion is that the UK and the NHS dealt with the COVID pandemic well, and I think you have to, by talking about well, I think the Prime Minister defined it reasonably well by saying that it's the effect on people, the effect that COVID has had on the socioeconomic impact that COVID has had. But I think it also means we have to have a comparison point. We have to have a relative point of comparison for well, because otherwise there's no sort of good, if you get what I mean, because if you don't have a comparison point, you can't say that this country did well, this country did bad. You just have one. You're just talking about benefits, really. So this also came up quite a few times throughout the speech. I think Bill talked about how you can't really compare to other countries, and I slightly disagree with that because I think that is one of the only, if not the only way to talk about relativeness in this debate, to have that point, and that's how you explain how the UK did well, by saying that they did better than these countries. I think I do get where you're coming from, because there are, of course, some points that are unquantifiable, or there are too many factors that influence it, which means that you can't compare it with other countries. But there are also factors that you can compare. For example, countries like Finland, you can compare their economic climate with that of those surrounding them, like Norway. And so you can have a relative comparison with other countries. So I think maybe if you'd been a bit more specific and talked about that relativeness that you can't compare. I understand, but what I was saying, it was correct, but it was just a bit too general to be correct in that context, is what I'm saying. So you had a point there. Okay, regardless, I've gone into a bit too much specific instantly, so I'll talk about general now. I think it's better to talk about the content rather than the style and stuff, because I think that'll be more useful in the context of Mediccom. So I'll ignore stuff like our fulfillment of roles and specific things about British parliamentary debate. So a problem that a lot of you faced was that you outlined too broad topics at the beginning, and then when you gave points, you didn't really you sort of had like only one big point, and then everything came underneath that. So maybe try and flesh out your points a bit more. Give a bit talking themes rather than like overarching topics. For example, instead of saying, the UK government had good policies, talk about themes like they tackled the mental health well, which you did like give examples for in those points, but you could have just fleshed it out a bit better. And you also have to explain why in the context of the definition that your point is correct. Some of you just said the point and then gave examples for it, but you also have to go the step further and you have to explain why your reasons mean that the UK did better than other countries, or they did well in what they're doing. For example, instead of just saying that they had rapid action, and this was, for example, they had fast vaccination program, etc., etc. You have to also go further and explain that they did well with this because they were the first, rather than just saying they were fast. You have to say they were the first to do it, which shows that they did well in that context, if that makes sense. And I'm not saying all of you did that all the time. Like throughout your debates, you did explain that relatively why the UK did well. But I'm just saying you have to do it each time, which I know can be a bit tedious, but it makes your arguments that much stronger. Now, do you want, if you want specific feedback, you can ask. I'm not sure, Ari and Namitha, should I go through each single person, or should I just ask them if they want feedback or not?
No, that's okay. We'll have, as long as you've written down the feedback for every single person, we'll email it to them afterwards.
Yeah, okay.
Okay, cool. Is that everything?
I feel I'll go through some of the main points because I only really talked about how you should explain your answers. So I'll go quickly through the main points that came up and what I thought about them. So initially, you talked about how good guidelines reduce transmission. That was sort of the debate started at, and I think some people brought up good POIs against that. For example, Ashwin said, "How are you actually measuring this?" Because I think he tried to get at that you're not really talking about how relatively the UK is doing well. You're just saying things that UK did to improve their pandemic, but you're not explaining why it's doing well. So that's what I mentioned at the beginning about how you should explain. And you gave good examples, for example, the 2-meter rule, which I thought was good. And you also talked about how they did it effectively and they did it rapidly. And then on the other side, we came up with a rebuttal about why the guidance was from the WHO and not the UK. And I think this was a reasonably good point, that this does not really support how the UK dealt well with the pandemic, because so some of the ideas you're talking about, the UK didn't do, so you can't give them credit for it, which I thought was a reasonable rebuttal. And then you have the point about the worst death. This is the first time I think the worst deaths and high infection rates come up, and I think that's a very strong point because it's very quantitative, and it's something that you can compare relatively, like deaths per capita, and that means that you can see which countries did well in terms of how fast the infection spread and how many people died, and you can compare how well their healthcare systems dealt with that, because you can use a relative comparison per amount of population in that country. And then we talked about starting discussing more about the effectiveness and how lockdown was done and how the decision had a positive effect on the pandemic. I think when you're talking about, again, I said this before, but when you're talking about efficiency and effectiveness, you should always, again, say why this was good rather than just saying how they were fast. Because even if they were, like, let's say they did the entire vaccination program in a day, yet all the other countries in the world did it in an hour. Like, then you would see that, oh my God, they're actually pretty bad at doing vaccinations. So you always have to explain why they were better than others. So don't just say that, oh, they had a lot of vaccines and they got through it in this many days. Just say that they were also first. Again, some of you did say that, but a lot of you glossed over that. And I think those were the main points that came up. Economic factors came up later, which I thought should have come up a bit earlier in the debate, like how the people were laid off. And I think there was a good cross over there. Like, the people lost their jobs, their wages were affected, people were paid less. But then other people came back and said, well, this was realistically going to happen in a pandemic, which is more important. And also there were schemes like the furlough scheme to help prevent people being laid off, which was good. And I like that sort of hitting back and forth. And yeah, I think those were the main points that came up. I talked about how the relative comparison at the beginning. So it's okay. I think that's all I have to say.
Thank you for that feedback, Avril. I'm pretty sure that was helpful for everyone, even to us. So now it's time for lunch, and we'll see you back around 1:25. And please donate to our society charity when possible. It's they're the ones helping us organize this. They're the ones allowing us to do this, and we want to give back to them. So you all understand how COVID works and how detrimental it's been. So please give back. Right. Thank you, and have a good lunch.
Okay, everyone, so we're about to start the next debate. It'll be really cool if you guys can put your cameras on just to make it a bit more interactive. So the motion, or the next debate between group 3 versus 4 is: the age of digital media has done more harm than good in terms of giving people information about coronavirus. Yeah, so welcoming opening proposition is group 3, and opposition is group 4. So can the first speaker of group 3 come now and speak, please?
Hello, everyone. Can you hear me?
Yep.
Okay. Can I start? I'd like to begin my group's argument with our first point about social media companies and their failure to remove and enforce the spread of fake news surrounding COVID on their platforms. In this coronavirus pandemic, lies cost lives. A pandemic of misinformation has followed the virus like a lethal secondary infection, undermining public confidence in and commitment to the hygiene and social protocols we must follow to keep ourselves safe. This misinformation through digital channels administered by wealthy corporations that connect us all in a constant flow of information. The ingenious nature of their profit model is that we do almost all the work. We provide them with unprecedented insight into our beliefs, emotions, and preferences, and their algorithms analyze and segment us into archetypes to sell to other businesses for the purposes of advertising. Social media companies, nevertheless, have responsibilities to society. In a pandemic in which we have all had to do our bit, they have found it harder than ever to escape scrutiny. Studies show why this is so important. Dr. Daniel Allington of King's College London found that those who subscribe to conspiracy theories about coronavirus are less likely to follow guidance to wash hands, socially distance, and stay at home. Researchers at Oxford University found that those who believe conspiracy theories are also less likely to accept a vaccination, take a diagnostic test, or wear a face mask. A vaccine is now available, and over £10 billion has already been expended researching and producing it. Vaccines are among the safest, most effective, and consequential inventions in medical history. They have saved countless people from disease and death, and yet despite scientific consensus, vaccines are opposed by a growing social media ecosystem of counter-enlightenment actors, snake oil salesmen, and the misinformed. Tech giants realized it would be toxic if people knew how they nurture this deadly ecosystem, so they have made big claims on dealing with coronavirus misinformation. Of the 912 posts flagged and reported by volunteers in one of the CCDH's reports, fewer than 19 and 20 posts containing misinformation were dealt with. Much debate about misinformation on social media is about automated algorithms and detection, but this exercise shows that even when companies are handed misinformation on a silver platter, they fail to act. If these companies continue to make bold claims that they are acting and yet fail to do so, then politicians and regulators must step in and force these companies to pay from their lavish profits for the social harms, including the lost lives from the virus.
Point of interest.
No, thank you. For which they're responsible, and submit to deeper and more rapid regulation in future. The Will to Act report conducted by the CCDH found that between Facebook, Instagram, and Twitter, 90.6% of posts containing misinformation were not acted on by these social media companies, even after being flagged as containing misinformation. For the 9.4% of reported posts that were acted upon, the following actions were taken. 6.3% of posts were removed from the platform entirely, 2% of posts belonged to accounts that have now been removed from the platforms, and 1.1% of posts were labeled as false and remained on the platforms with a disclaimer. Although each of the social media platforms investigated failed to remove the vast majority of the posts that were reported to them, there was a significant disparity in the results from each. Facebook removed 10.2% of the posts reported to them, while just one tweet of 179 reported to Twitter was removed. Despite Twitter claiming to have adopted policies regarding coronavirus misinformation that appear to be stricter than either Facebook or Instagram. The reported misinformation that remains available on these social media platforms includes conspiracy theories and false claims such as viruses cannot be transmitted by air, COVID-19 is caused by vaccines, 5G mobile technology poisons cells and causes the illnesses known as COVID-19. Coronavirus is a hoax in order to cover for the erection of 5G towers, and wearing face masks can lead to cancer. False claims and rumors such as the ones mentioned are extremely frustrating as they can be very harmful to public health, overall making the spread of reliable information surrounding COVID-19 more difficult. Furthermore, a report surrounding the removal and enforcement of anti-vaccine propaganda found that 95.1% of posts containing containing misinformation were not acted on by social media companies after being flagged as containing misinformation. Of the 4.9% of reported posts that were acted upon, 2.3% of posts were removed from the platform entirely, 0.3% of posts belong to accounts that have now been removed from the platform, and only 2.3% of the posts were labeled as false and remained on the platforms with a disclaimer. This week action taken has done nothing to limit the growth of the wider anti-vax network, which across 423 anti-vax accounts has seen a net increase in its following, with an increase of 1.4 million since July 2020, now standing at 59.2 million followers. Furthermore, living in full view of the public on the internet are a small group of individuals who do not have relevant medical expertise and have their own pockets to line, who are abusing social media platforms to misrepresent the threat of COVID and spread misinformation about the safety of vaccines. As previously mentioned, anti-vaccine activists on Facebook, YouTube, Instagram, and Twitter reach more than 59 million followers, making these the largest and most important social media platforms for anti-vaxxers. Our research has also found anti-vaxxers using social media platforms to target mainly minorities, exploiting higher rates of vaccine hesitancy in their communities to spread conspiracies and lies about the safety.
Point of interest.
Yes.
There have been many celebrities and people who are well known that have actually spread positive messages about vaccines, and many people have chosen to believe them through digital media.
While that may be true, there are many notable figures that have spread extremely hateful and damaging messages surrounding coronavirus and vaccines, such as Robert F. Kennedy Jr. And analysis of over 812 posts extracted from Facebook and Twitter between the 1st of February and 16th of March 2021 shows that 65% of anti-vaccine content is only attributable to 12 main celebrities and notable figures.
But isn't that just the minority of celebrities?
But it's the minority of celebrities controlling a large margin of the message that's being spread around vaccines. So while you may have many celebrities spreading positive messages, the amount that number of people that they're reaching is much less than the number of people that each one of these 12 main figures are reaching individually.
Okay, thank you.
This shows that while many people might spread anti-vaccine content on social media platforms, the content they share often comes from much more limited range of sources. Exposure to even a small amount of online vaccine misinformation has been shown by the Vaccine Confidence Project to reduce the number of people willing to take a COVID vaccine by up to 8.8%, which is a major hindrance in the country's attempt, to recover from the pandemic.
Point of interest.
Yes.
Would you say that the public users are also responsible for ensuring that they follow the correct information?
I would agree with you, but research has been shown that most people aren't actually able to spot fake news themselves. 9 in 10 older children say that they are aware of fake news, but more than half of those who use social media for news find it difficult to tell whether stories on these platforms are accurate or not. And this was from an Ofcom report earlier this year. Furthermore, humans are generally very bad at detecting fake information. And this is because fake news often looks like real news. And we think we recognize a pattern. Fake news also has an advantage when it comes to sharing information. When sharing information online, we give things very little scrutiny. We are also more inclined to share bad news, and a lot of news related to COVID-19 is bad. Modern psychological research concurs under uncertainty, people seek safety, security, and order to compensate for a lack of control. And COVID-19 produces uncertainty, and people want to seek safety and security in it. One of the things we know from classic anthropological work that we research is that misinformation thrives where people have little control over environmental threats, like volcano eruptions, unpredictable weather events, and in this case, disease. So I'd like to wrap up my argument where this is an immediate crisis where inaction has cost many lives. This is not the first time the CCDH or other civil society organizations have warned of the chronic and acute dangers of misinformation. When it comes to hate or misinformation that flows across their platforms, social media companies have proven they do not care and listen only to advertisers and the threat of regulation. They do not listen to polite requests for change. Given the acute nature of the coronavirus pandemic, their failure to act must now be met with real consequences, or we as a society must now look to other media outlets to rely on for information. And this is seemingly already becoming a reality, with a recent poll by Ofcom revealing while TV remains the most popular way for people to follow the news, used by 75% of people, the proportion using social media to keep up with the latest stories fell from 49% in 2019 to 45% in 2020 during the peak of the coronavirus pandemic.
Okay, thank you. Now introducing the first speaker from opposition. Could you also please turn your camera on?
Good afternoon. My name is Ananya, and today I will be arguing that digital media does less harm in terms of giving people information about COVID. So why is this true, you may ask? Well, let me tell you. Digital media helps to provide useful information updates to the public about things that are happening at the moment. This can be referred to with the term public dissemination. This means the spreading of news within a large number of people. So what do I mean by this? Recently, there have unfortunately been new variants in different countries. An example of this is the Delta variant in India, which has affected people who are even vaccinated, as well as decreasing the amount of oxygen that could be provided to those who need it in hospitals. Though this might be severely over-exaggerated to the media, it is important for us to know the upcoming restrictions that may be put in place to help protect us from such measures. For example, one ongoing restriction is the wearing masks. This has helped in limiting the amount of contact people get, as it covers germs that may spread from the nose and the mouth. It has been enforced in places such as workplaces, supermarkets, and even schools. Thanks to the media, it has shown people the importance of social distancing and how it helps to limit the spread of the virus. Along with new variants, increases cases and deaths could be displayed through the media as well. This helps to prepare people of the safety measures that could be soon placed, as well as inform them of how the pandemic is going. While it may be distressing for people to hear, it is good to know these statistics. Some examples of useful statistics that have recently been dispersed are that Wales has about 5,000 deaths in the last 2 weeks. Furthermore, India has a daily average of 722 deaths daily. This may be unfortunate for many people to hear. However, there have been many statistics that show a decline in deaths or a decline in cases, which can help boost morale within communities as well. Recently, countries have been more lenient with travel as the virus is not as severe as it was before. Locally, they have become more free with the number of people that can meet up in a household, for example, 6 people per household. Though this sounds absurd to many, the media helps to ensure the reasons behind these actions. Furthermore, it allows us to view whether a country is classified as red, in complete lockdown, meaning there is no ability to travel. Amber, partially lockdown, but still more free to travel, however, you have to know the risks behind and the caution. Or green, you are free to travel and it is safe. As the summer months approach, with holidays arising for children, people would automatically have the desire to travel abroad. The media would give them the opportunity to choose their country of choice. If this is not enough to convince you, how about the fact that the media allows us to know the new restrictions or freedoms we may have within our town, city, or country, which can help plan people's visits to meet their family and their friends. Yeah.
You said that the media allows for people to know about where they can travel and which countries they can travel to, but it was actually found that more people are losing trust in the media, and they're finding more trust within different forms of media outlets such as the radio, or they hear it from other people themselves. So do you have anything to comment on that?
Well, that is true. I agree with you. However, hearing from other people can actually be false, inaccurate, because there are many sources in the internet that can be found and they don't know where they have picked it up. So people need to be aware that they need to be looking on verified social media sites or verified digital media sites to get more accurate information, as the media seems to be regulated by the government. So in my opinion, though this may be true, it's better to get more accurate information from online where it can be trusted, if that answers your question.
Did you know that trust from last year, before the coronavirus pandemic began, trust is down 38% to 35%, impartiality is down 37% to 34%, and the accuracy of the digital media information that's being spread is down from 39% to 36%. So really, you can see a downwards trend in the accuracy and reliability of the information people are finding online on social media, which would lead people to believe that social media isn't actually a good source to be finding information from.
Well, as we all know, the current situation of the virus is constantly changing, whether we're in lockdown or whether we're not. And the age of digital media has helped the government transmit information to each other as well as companies. So I believe that though the accuracy may be declining of how reliable the source is, that also is, you can also blame that on the fact that the situation is constantly changing. And yes, it won't always be accurate because cases keep rising, but there are some useful sites that you have to believe that can be trusted. So you shouldn't overlook the benefits of the media completely.
Okay, thank you.
As I have talked about the ways that the public can receive information, I will now move on to the point of how the media helps leaders of countries prepare for upcoming problems. As we all know, countries such as Australia, New Zealand, and Russia closed their borders immediately after hearing about this new virus, which saved them from mass increase of cases. This is a positive effect as it helped retain severe arising of positive cases in many countries around the world. These countries stopped imports and exports from countries they knew they were affected, which also helped their situation. Italy and Spain, few of the first countries in Europe that were severely affected and this was picked up by the media as it helped spread awareness. Although after the measure of lockdown was taken, this raised a lot of panic as people started stress buying from supermarkets. As we all know, toilet roll was extremely low in stock. The media then played a role to stop panic buying and how much the pandemic had affected people's mindsets, which helped people calm down and gain a better perspective. Overall, to conclude, I believe that the media does less harm than good in terms of giving people information about COVID, as it helps with public dissemination in many ways, such as statistics, which can be seen as over-exaggerated, though sometimes useful, and helps countries keep safe from increasing number of cases. Thank you for listening to my debate.
Okay, thank you. Now on to the next speaker.
We believe that the age of digital media has done more harm than good in terms of giving people information about coronavirus for many reasons. But the second one that I'm going to talk about now is fake news. And a major part of this is scare stories and disinformation. Though digital media is good because of its accessibility, because most people can actually use it, this is also one of its biggest downfalls. With recent technology, information and fake stories can be posted online for everyone to see with the click of a button, and almost anyone can do this no matter what your credentials are. During the coronavirus pandemic, the population was told to stay home, while the world's top scientists and doctors worked hard trying to manage cases and find a vaccine. This led to most people looking towards digital media in order to keep up to date. WARC stated that daily online content consumption has doubled since the start of the pandemic, now at over 6 hours a day. Our generation is now labelled as a nation of content creators, and as a result, the World Health Organization has dubbed the spread of fake news as an actual infodemic. Disinformation has surged because of COVID, with many capitalising on the event, taking the opportunity to disrupt public order or manipulate an agenda. These malicious attempts are even more dangerous due to the speed fake news can spread on digital media, reaching great numbers of people before it can be disputed. After only 2 weeks, information from non-specialists could be seen in mainstream media. Disinformation with alarming tones resulted in people rushing to buy PPE, such as masks and hand sanitizer, and therefore there was a lack of it in the actual clinical sector. The NHS released that patients actually refused to take ibuprofen and anti-inflammatory drugs because they were falsely informed that they would distances of catching coronavirus. News of correlation between cancer and wearing masks appeared, which is detrimental to reducing cases. Disinformation can also be caused by blaming others. During the pandemic, many people blamed illegal immigrants and even whole racial groups. This type of publicity would only increase hate and alarm during an already hard time for the country. However, disinformation is only one part of fake news, and another major problem digital media caused during COVID was misinformation. This refers to misleading advice or statistics spread by perhaps well-meaning but ill-informed people. People can promote or spread news that is not medically correct or accurate. Many sources in digital media will not be experts in their field, and therefore may confuse facts or not get everything written up accurately.
Point of interest.
Yeah.
You said that there are many people who have said false information. However, don't you think that there are actual sites that do have medically accurate information that could be trusted?
Yes, there are obviously a lot of actual experts online, but many people find it really difficult because fake websites tend to copy the trusted ones in terms of visuals and things like that. And this makes it very difficult for the population to tell the difference. So they might get their information from untrusted sites. So you can't really be sure.
But if the information is being copied, isn't it still accurate from the sites that can be trusted?
No, so they might copy the way a site looks, but then they might exaggerate facts and results, because in disinformation, people are actually trying to affect the public and they have malicious aims. So they won't actually copy the information completely.
Okay, thank you.
So there was a Malgorithm report from the Centre of Countering Digital Hate in 2020, and they showed that Instagram recommended 104 posts containing misinformation, with 57.7% about COVID-19 and 21.2% about vaccines. Because of Instagram's help, these posts of misinformation gained over 230,000 likes. This is a very common example of misinformation, is even the term coronavirus, as this refers to a family of viruses, some of which can cause the common cold. The term is not actually limited to the virus which causes COVID-19. Misinformation, unsupported by medical evidence and masquerading as official health guidelines, may contradict official health advice. As a result, individuals are more likely to endanger themselves and others. There is evidence that misinformation can cause humans to take greater risks, such as sharing food with ill people and failing to wash their hands. It has been reported that in Iran, more than 300 people have died after drinking methanol, which is a highly toxic substance, following false claims that it could be used to treat COVID-19.
Point of information.
Yeah.
Many people would argue that the age of digital media has transformed the way that we receive information and educate ourselves. So would you not say that without the sites and digital media that we are provided with today, we wouldn't have been able to learn all the things we have about COVID and the pandemic?
Yeah, I do agree that it has really transformed how people receive information, but there are still many other fields and ways that people can get their information, such as newspapers, and there are many people in the community that don't really use that much digital media, maybe because they don't know how it works, and therefore they may use stuff like newspapers, and these are usually more trusted because if they go to the
although that might be true, I would argue that a lot of people haven't.
They'll make sure all their information and articles are reliable.
Sorry. Although that might be true, I would argue that a lot of people haven't been using newspapers. Although some people do struggle with digital media, it is widely used, especially from the ages of 16 to, let's say, 45.
Yeah, I agree with that. And a lot of people will use digital media, but what we're saying is that this might be bad in some cases because it is really widely used and it's not always completely trustable or accurate.
Okay, thank you.
So one massive area of misinformation that surged during COVID is vaccines. An investigation of 409 English language anti-vax social media accounts showed that they now have 58 million followers. People came up with, and still are coming up with, inaccurate statements on the side effects of vaccines. Using poor research, many suggested that the vaccine causes infertility, mutations in human DNA, and even death. These claims are not based on viable results, and therefore merely scared the public into being hesitant to get the vaccine. Rumours such as pharmaceutical industries fabricating results of vaccine trials to boost their profits also became fact for many. Therefore, digital media and fake news in particular were hugely detrimental during this pandemic and has definitely done more harm than good in terms of giving people information about COVID. Thank you.
Thank you. Now on to the next speaker from Group 4.
Hi, my name is Sammy, and I'm the second speaker for the opposition. I will be talking about how social media has helped distribute information about COVID-19. Has allowed people all over the world to join together in an online community, with over 4.5 billion people using the internet. That is about 60% of the world's population, and 3.8 billion social media users across the globe. It has connected people of all age groups from different generations, with the majority of users at 67% being between the ages of 16 and 24, and the smallest age group at 18% of 75 years and over. So how does this help us? Firstly, it allows people to share their experiences, which may help others learn from their successes or mistakes. For example, news stories about people who have not been following the regulations of the pandemic and have fallen ill as a consequence may encourage others to abide by the rules. Moreover, members within these online societies can self-organize and respond to issues, increasing their resilience and organization. This can be done locally, as many people have been reaching out to the elderly and vulnerable to offer aid to them with tasks like grocery shopping and collecting medicine. Social media can significantly help reach out to others, as Facebook has introduced a feature where volunteers can assist those in need. Also, local groups such as Good Neighbour have allowed volunteers to stay in touch via social media, and there are more than 4,300 similar groups which have allowed approximately 3 million people to connect. The NHS set up a phone app with a volunteer scheme known as Volunteer Army. Within the first 24 hours of this being created, 500,000 people had signed up, and by early April, over 750,000 people had signed up. This just shows the extent at which social media can reach out to others and how fast information can be spread. This recruited them for tasks such as delivering medication from pharmacies, driving patients to appointments, and making regular phone calls to isolated individuals. This platform has also allowed people to address issues on a large scale, as many have voiced criticisms of the government. One big movement was the Where is Boris hashtag, when the UK questioned Conservative government's initially passive approach to the pandemic. Furthermore, public figures take on a sense of leadership in the community. Although social media may be primarily for entertainment and leisure, many influencers have taken it upon themselves to emphasize the importance of distancing. However, I will acknowledge the fact that there are some influencers who do not obey COVID regulations. While this may incite viewers to do the same, most people are aware that this is not what they should be doing, with many even letting the creator know in the comment section or unfollowing them due to this. The government portrays the rules of the pandemic in a formal manner, which may come across as displeasing, and hence not deliver the intended message, whilst social media influencers use humour in their delivery to ensure that this critical information is disseminated in a form that is pleasing and easy to comprehend.
Point of information.
Yeah.
So you're saying that social media influencers use humor and to relay the information, but couldn't this humor conversely be taken in the wrong direction and misinterpreted by people? They may not be able to take their information seriously, leading them to not follow through with what the influencers want them to do.
Yes, this is true, but for many people, it can be quite intimidating the way that the information is portrayed by the government and other companies. And as many people look up to these social media influencers, their delivery can be more impactful in them receiving the information than from other sources.
However, for many of the social media influencers, the posts they make they're not linked to the government, and they have no links to the government. So the posts they make are from the facts they have heard themselves, which filters them to a point where you end up listening to people's own opinions rather than facts. And if these social media influencers end up having one wrong opinion, just one can cause a massive impact on the way people protect themselves from COVID-19.
Well, this is true. I think us as a online society have managed to counter false information and are aware when information is false, and many people have let creators know when their information isn't correct and have even unfollowed them or cancelled them due to this. So I think creators are also trying to make sure that they are receiving their information from accurate sites, because they want to provide the best information possible. And us as viewers also know what is correct and what is not.
Okay, thank you.
There has also been an increasing amount of young children using the internet, and many videos have been made to educate them on the pandemic in an engaging and fun way. So not only are we reaching out to teenagers, middle age, and the elderly, we are also impacting young children who are growing up during these times. I'm sure you are all aware of the recent vaccines that are being distributed to provide immunity against COVID-19. The UK government, as well as those of other countries, are working towards providing everyone that needs the vaccine with the opportunity to have it. However, many people are opposed to the vaccine as they worry about the potential negative side effects, and some may believe in the conspiracy theories that others have formed. Not only have social media influencers promoted the vaccine, but celebrities have too. As these figures hold respect and are admired by many and have a large following, their words have caught the attention of much of the general public and have been posted on various social media platforms. Therefore, this helps spread the awareness of the significance of the vaccine in an attractive and humorous way, which the government could not achieve.
Points of information.
Yep.
So the way that the social media influencers are able to spread awareness around the vaccine, couldn't someone also use, so another influencer such as Robert McCullough, he spreads information against the vaccine in the same way that these social media influencers spread it for the vaccine. So what I'm saying is social media could be used to spread things quickly in a good way, but also in a bad way too. And these COVID anti-vaxxers use this to spread the information around to a large number of people very quickly.
Yeah, there are definitely celebrities. We shouldn't overlook the benefits that social media has provided just because some people may not portray the right information, and everyone is entitled to have their own opinion towards the vaccine, but this will just help others form their opinion, and hopefully a positive one. I hope that answers your question. So what can we do with the information that we learn through digital media? Many sites have been set up to allow us to donate to charities and causes supporting the world's plight against the virus. People all over the world have been made aware of struggling countries through statistics and media posts. Not only are they made aware of the problem, but they are also given the chance to make a difference by donating to other countries that need support during these difficult times. A significant amount of these donations have been put towards medical research. In conclusion, some argue that the internet is the fastest way to disseminate information, as the average internet user spends about 7 hours online each day. The age of digital media has allowed us to connect through social media and form strong communities. This allows them to share their experiences and learn from each other, acknowledge and respond to issues, as well as raise awareness for problems. But this is not just limited to the screen. The digital age has enabled people to help others in their neighborhood and donate to causes. Social media influencers and even celebrities have also participated in the fight against the virus, which has promoted a fast dissemination of information to their numerous supporters. Thank you for listening.
Thank you for that. Can we introduce the next speaker, please, from group 3? I think it's Matthew. Take it away.
For our third point, we are going to be talking about progressive growth through social networks. Another thing, and the issues it causes in spreading information about COVID. Another thing that shows that digital media has done more harm than good during the pandemic is something called progressive growth. This is when someone receives a piece of information, which could be a statistic or a piece of advice, and they misinterpret or exaggerate this information when giving it on to other people. Let me explain an example. Someone posts an image on Instagram of a shelf in a supermarket that's empty, labeled toilet paper. Many people may treat this image as saying that toilet paper is about to run out and that everyone should go out and try and bulk buy toilet paper so they have enough for themselves. Now, if I then post another thing on a different type of social media that explains that message that toilet paper is going to run out.
Point of interest.
Yes.
You're saying that it may portray a negative image, yes? But some people may take this as a positive way, being like, some people don't have toilet paper and they may stop taking as much for themselves, which can help the whole community. So what are your thoughts on that?
Yes, there will be some people who are being responsible like that, but it only takes a small minority of people to buy lots and lots of toilet paper to completely disrupt that part of the supermarket.
But through digital media, that message can then be spread quicker, saying that there is less toilet paper and people are in need of it, and that people are taking too much. And then people can then start to become more responsible as it's being spread quicker through digital media, which is a positive effect of it.
Yes, that is the positive effect of social media, but there will be some people that still panic due to all this fake news on social media around these items.
Yep, okay, thank you.
This then all links back to these other scare stories through social media, especially during the start of the pandemic, when it wasn't as serious and things hadn't really escalated yet. For example, when it was just affecting countries such as China and Italy, around social media, things were being spread about how the worries of this virus and about the death rate and what it might do to you and things. And this did cause a panic at the start of coronavirus, leading to these problems such as the bulk buying and other things. Another reason why...
Information.
Yep.
Would you not say that people being scared about the pandemic is good because it has encouraged them to stay at home and follow the rules of lockdown?
Yes, in that sense, it's a good thing that they're scared because it means that they'll follow the rules. But in another way, it may cause them to do other things that seem selfish and that might not affect the community as a whole. For example, staying at home when they say if they... Yeah, so the fake... Yeah, that's actually a good point. I don't really have any response to that.
Okay, thank you.
A December 2021 study by Sahil Gupta and others labeled Media Exaggeration and Information Credibility Analysis mentioned in their conclusion, and I quote, "The results of semantic analysis have indicated that community has a very negative influence in spreading the information about COVID." Another point is that not all people have access to social media in the UK, and due to society having such a being so reliant on social media as a form of relaying information, the people that don't have access to these sites of information end up suffering in the sense that they will not be able to gain the necessary instant
Point of
precautions
interest.
that have been in place. Yeah.
I agree that some people don't have access to social media. However, don't you think that they have people around them that do have access to social media?
Yes, they will have people around them, but the people that wouldn't have access to social media might not be able to get these messages in very quickly. So, yeah.
But I'm guessing people in the household that they are living in, at least one of them is ought to hypothetically have social media and can easily pass on the message if they need to, if it's that severe and important that it's impacted everyone.
Yeah, but in severe cases where people might be living by themselves, or they might not actually have somewhere to live at all, they're the places where they don't have access to this information.
Yeah, thank you.
Another interesting statistic is that 50% of people in the UK say that they come across more than one piece of fake news every day, and these can really cause significant impacts around the pandemic and the stories that people might believe. Thank you.
Okay, thank you for that. And now can we have the final speaker from the other group to speak?
Good afternoon. I'm going to be covering for Nishita, who is unable to make it today. So, social media has rapidly become a very popular platform for sharing information, rather than using adverts on TV or using the radio. Research has stated that 49% of adults in the US alone stated that they preferred listening to the radio for information rather than getting information from social media. This shows a large majority prefer getting information from social media, and more people are joining social media for this purpose. One of the largest social media platforms for sharing and distributing information is WhatsApp, which has over 2 billion users across the globe in 2020. It is stated that there are around 1 billion group chats and still counting. This alludes to the fact that information is unchallenging and easy. During COVID, some of the most crucial information sharing is about vaccines. Forwarding messages about Yeah.
You said that WhatsApp is a very good media to share information, but the messages people can send on WhatsApp, they could very well just be their own opinions or rumors they've heard and they've spread around. And especially when you're hearing it from a family member, you're more likely to believe it. So wouldn't that make it much easier for fake news and misinformation to be spread around to people through that media?
I agree with your point because WhatsApp is known to have lots of false information. However, there have been, so suppose you hear false information and you confer with someone else and they've heard something else. You can then check it with someone who you think is going to be more accurate, let's say a doctor, who may have more information about what's happening with, let's say, vaccines or what's happening with COVID. And this can actually help you clear the interpretation that you have heard.
And what happens if people cannot get with a healthcare professional or in time to be able to solve their queries?
Well, I'm sure that there are accurate sites on the internet that are from healthcare professionals that can easily help clear that up, as well as there has to be some people that have actually conferred with those sites rather than believing WhatsApp groups, as they are known to be inaccurate, and they can easily help clear that up. If that answers your question. Forwarding messages about leftover vaccines to families and friends allows a larger group of people to book vaccinations in a shorter period of time, instead of waiting for the government to inform them. In addition, group chats allow people to hear about the side effects of vaccines from many people who are close and reliable, which expands and increases the confidence of a person to get the vaccine themselves. In addition, WhatsApp. Yeah.
Wouldn't you say that if people are spreading around the negative sides of the vaccines, wouldn't this put them off from getting one themselves?
Different people react differently to the vaccine because each person's body is different. So some people may have had a positive experience with the vaccine, so less side effects, and they're completely fine. Whereas some people have had more side effects, so temperature and feeling poorly for a couple of days. So people will start to understand that there's a difference in side effects, and people just have to kind of interpret that each person will react differently, and that's just how it is. So it's more of an opinion and how you react to it rather than inaccurate and accurate information, basically.
Okay, thank you.
So WhatsApp is great for sharing videos and documentaries. This is greatly helped people to gain information about situations in other countries and how COVID spreads. This has more than one purpose. It provides a great valuable information for people who are illiterate and literate, and is a basic form of entertainment also because of lockdown. WhatsApp can rapidly share these types of information and therefore reaches a large group of people. Some documentaries and videos were particularly aimed to instruct people about safety and regulations and raise awareness about these situations. Children in particular preferred this way as it was visually appealing to them and had a great effect on them. The sharing of information that is critical to prevent the virus from increasing and spreading. It has made people feel responsible and made them feel as though they have had a role to play in this pandemic. Many people, such as social media influencers, played a key as almost as an important role as doctors themselves when sharing information. Unfortunately, there are many people without access to the internet and social media. No, thank you. And they do not receive vital information that others do. Moreover, social media is a brilliant platform to learn about news from different parts of the world. Just from a simple search, we are able to gain information and news about what is happening in different parts of the world or country. This is very significant because many people live abroad and away from family, and therefore social media is a great way of finding out about situations about the area or family personally from themselves. Additionally, volunteer stations have been set up which allow people to send inquiries that they may have, which in fact reduce the panic and stress. For example, a station in Cornwall received approximately 500 questions a day. But some people may argue that social media spreads false information and expands the unnecessary panic in people. However, the majority of social media platforms are able to stop the false rumors from spreading. Firstly, no, thank you. Firstly, Facebook. It is very well known for using sophisticated algorithms to control the news feed of users. This prevents the spreading of fake news and illustrates how further advanced technology is. Another example is YouTube, which has 2.3 billion users, which is another example of a social media platform which prevents false information from spreading with its strict guidelines on COVID-related content. Many videos have also noticed for people who may feel distressed about this information as a warning. Twitter, with 186 million users, places warnings on tweets. They are factually incorrect, for example, and they are censored information posted by, for example, Donald Trump. Overall, the digital age that we are living in has given us the ability to quickly distribute key information, and although there may be flaws in the system, we should not overlook the many benefits that it provides us. To conclude, our group believes that the age of digital media has done less harm than good in terms of giving information about COVID-19. We have discussed that public dissemination and how leaders of countries use it to help to plan problems ahead. We have also explained how the increasing use of the internet and social media has created fast and reliable way to transmit critical information, and not only has it allowed people to help on screen, but also in their local community. Thank you.
Okay, thank you everyone. And now we're going to pass it on to Avril for his feedback. So take it away.
So I'll start by telling you all what I think this motion is about, how you tackled it, and how you could sort of improve your structure a little bit. So this motion is about how social media has detrimentally impacted people's lives, and this is specifically in the context of receiving information about COVID. Now, a lot of your speeches were entirely about misinformation, but I think it's a lot more than that, because I think only one person really talked about how normal news you could receive could also be distressing. And if you read the motion, this also comes underneath that definition, that receiving information about COVID doesn't necessarily have to be misinformation. It could still do more harm than good. So now I think fake news does come into this, definitely, and it's true, it should be a large part of your debate, because it is one of the most prevalent, if not the most prevalent part of the debate. The misinformation causes anxiety, it causes people to not conform to social rules, etc. But it's not right only to discuss about misinformation. And the job of the proposition here is to show why it causes more harm than good, and the opposition has to show why it not, rather than just saying that it is good or it's bad. And there's a subtle difference between those two, and that is that you have to compare the two. Most of you ended up giving examples for why it was just good or bad, but you had to explain why it was good rather than bad, or bad rather than good. And you have to weigh it up. You have to, instead of just say social media is good for spreading information, you have to say social media is good for spreading information despite this. That could sound a little vague, so I'll give you an example in the context of what you guys talked about. So instead of just saying media is good for spreading information, say it spreads more accurate or useful information than inaccurate information. And even that inaccurate information that it spreads, that can be weeded out, because like there's verification and stuff like that. Like you'll know if the message is from the WHO, it's more likely to be accurate than just a random person tweeting something. And this information, useful information, leads to good because people are more informed about precautions. And this is more important than the small number of people who will be affected by this unverified information. Now, I know like that's not strictly true, because like the anti-vax movement, etc., they still believe that people still believe that information, even though it's not verified. But I just wanted to give you an example of how you could perhaps like weigh the arguments up, rather than just saying social media is good or social media is bad. Now, another thing a lot of you talked about is why fake news is very prevalent, but you have to go a little further than that. You're not only here to explain why misinformation is such an important factor. Don't spend a lot of your time of your debate talking about why it's so important. Instead, you have to talk. You're trying to explain why the harm is more important, rather than the actual misinformation. Why the spread or the prevalence of it, if that makes any sense. So you're not talking about who can see it or how wide it is. You have to talk about more about why the actual harm is more damaging than what's good about it. So maybe spend a bit more of your debate talking about the actual effects of the misinformation. Now, it can be useful to talk about misinformation, or just information in general, because that's what the debate is about. It can be useful to talk about the prevalence to explain why the harm is more important. So, for example, if you said 20,000 people are impacted by the harm, whereas only 10,000 people benefit from it, you can say, oh, the harm is greater than the good because more people are impacted. But in the majority of contexts, you want to be talking about why the harm is more impactful. It might cause higher infection rates, which causes people to die, whereas in comparison to that, the benefit might just be they know more about the pandemic. So you could talk about how perhaps that death or increase in deaths is more important than just a few more people being informed, if that makes sense, because you're talking about principles of moral, and that makes your arguments. You're talking about moral principles, and that makes your arguments stronger than if you were just talking about numbers. Especially when you're talking about harms. Now, if it was a debate about more people are affected by social media, then you would want to talk about numbers more. And I also felt that the debate could be defined a little better at the beginning, because when you define it, there's like a clear place where you can argue. For example, if at the beginning it had been defined that it was all misinformation, maybe the debate would have focused on more all types of information rather than just misinformation. And I felt that could like defining what actually harm means and what sort of information is included in this. And I did feel that a lot of you brought up quite some interesting points, though. For example, I liked you talking about how it affects minorities, or how social media can reduce confirmation to social measures, like if some people, like let's say a celebrity doesn't wear a mask in public, then it might lead to a lot of more people not wearing the mask as sort of role model. So I like the point that you brought up about that. And also fake news can cause people to harm themselves, like people drank methanol because I think something happened on social media. I can't remember the exact detail. And also it's very prevalent, so it can influence people. It's difficult to tell what's actually real. And I thought those points you brought up were good. And on the other hand as well, the points were good. For example, it's very educational. It can help people more than it can make them. The verified information can help people, and there is a lot of it in social media companies do, even though the social media companies do try to cut down the unverified information, which was useful. And lastly, I just want to finish on a point about structure. It was sometimes a bit hard for me to follow some speeches. So at the beginning, if you just say what points you're going to make, it'll just make it so much easier for me to structure my speeches and make it clear when you're moving on to a new point. That's all I have. Thanks.
Okay, thank you, Avril, and thank you to both of the groups for their really good debate. And now we have our last debate coming up. But before that, we just wanted to remind you, if you haven't donated, then please do. The link is in the chat box. As well as that, we have our guest speaker coming in around half an hour. So please type in some questions, because he's giving his time up for all of us. So it'd be great if you could just ask as many questions as you want. And yeah, I'm going to pass it on to Arjun now to introduce the last debate. So take it away, Arjun.
So now we will talk about the topic, the economic and social consequences of lockdown. Orders could cause more harm than the COVID-19 virus. And I'd like to introduce the opening proposition speaker.
Good afternoon, everyone. Oh, begin. All right. Lockdown was harshly introduced to the younger generations that evaded the SARS pandemic. Social distancing was a term that only existed in our mental glossary since the dawn of the COVID pandemic, and compulsory wear of masks was implemented for the first time in history. The pandemic struck at a time where humanity could not be more unprepared, and what followed was a tapestry of wrong decisions. We were faced with a microscopic entity that could remain undetectable while being highly contagious. And as a result, lockdown orders were enacted, and it was a poor and desperate attempt for control in the midst of chaos and confusion. Evidently, after 19 months of periodical lockdown, the battle against COVID has barely made any progress in certain countries. In some countries, the situation was handled so poorly that it gave the virus an opportunity to evolve. In other countries, casualties and infection rates skyrocketed. The virus consigned the global economy into the worst economic recession since World War II, while failing to achieve any of its agenda. On 18th April 2020, 158 out of 181 countries' businesses across the country were required to close temporarily or implement working from home. And as of 8th of July 2021, 106 out of 158 countries have maintained or reimposed lockdown, condemning detrimental negative effects on the global economy. According to the World Bank forecast, the global economy will shrink by 5.2% this year, and this represents the deepest recession since World War II. Per capita incomes are expected to decline by 3.6%, which will tip millions of people into extreme poverty this year. The worst part of all is that The negative effect of a lockdown in one region may diffuse through supply chains into other regions. Each closure will have interactions with more businesses, igniting a chain reaction that will cause more and more businesses to cascade into bankruptcy. When a firm is closed by a lockdown strategy, the productivity of its clients' firms is likely to suffer because of a lack of supply of intermediate goods and services. Suppliers of the closed firms are also likely to see reduced production because of a shortage of demand. What do I mean by this? Well, Sweden, for example, unlike other European countries, did not impose a strict lockdown in 2020 in an attempt to minimize the economic effects of the pandemic. However, it experienced a 7.4% reduction in GDP in the second quarter of 2020 compared to its previous year. This reduction in Sweden is comparable to those in neighboring countries, those that actually imposed lockdown, probably because of the propagation of negative effects from lockdown countries to Sweden through economic networks. Now, how does all this translate into COVID causing more harm, lockdown causing more harm than COVID? Well, the stringency of lockdown is often framed as a trade-off between lives and economy. And what constitutes the prosperity of a country is its economic growth and innovation. Why? What about lives? Doesn't happiness of a population equate to the success of its country? Well, growing economies turns less into more, and this surplus of goods and services makes it easier to improve certain standards of living, which in turn generates more happiness for the long run. Lockdown impedes this paramount principle and strives to save lives in a reckless manner. On the contrary, COVID actually helped stimulate the economy, while the lockdown drained it. The most unexpected benefit perhaps comes from high mortality rates of the elderly. The only people that are truly in danger of dying from COVID are people above the age of 65. And what I'm about to say might sound callous, but the reality is that old age comes with a cost. An aging population will slower labor force growth affects the economy in many ways. Growth of GDP slows due to working age people paying more to support the elderly, and public budget strains under the burden of the higher total cost of health and retirement programs for older people. COVID brings to the table an unexpected consequence which humanity can take advantage of. This is further exemplified in developing countries that did not impose lockdown, where their younger age structure means that COVID is likely to substantially be less deadly than in advanced countries. I'm not disregarding the fact that COVID is effective at slowing the pandemic. It simply lacks strategy and coordination in place to compensate for its disadvantages. A lot of the aforementioned data could have been anticipated, and prevention measures should have been in place before imposing lockdown. Its failure to do so has caused more harm than the virus itself. In my home country of Hong Kong, businesses died so fast that the country rolled out 3 rounds of relief measures to save the dying businesses, involving some $191.5 billion. Thank you. Oh, is there any POI? That's the end of my speech so far. Maybe change to the next speaker.
Okay, introduce the opening opposition speaker. And also, we encourage cameras on during the debate, so I'll be thankful.
Okay, so good afternoon to all the speakers and listeners today. As the first speaker of the opposition team, I would personally like to introduce 3 main points. I will be discussing the social impacts due to COVID-19 and the lockdowns that have been placed in order, and my partner will be sharing her view and points on the more economical side of this debate. Before I start, I would like to offer a rebuttal regarding a point made by the first speaker of the proposition team. So while they have brought in some interesting and insightful points, such as how lockdown was a poor and desperate attempt at controlling the virus, side proposition has completely neglected how, until we have a vaccine, lockdown really is the only way that we can reduce the spread of the virus. I will now move on to my first point. So COVID-19 itself has brought more harmful effects to the members of the society than what lockdown has brought. To begin with, the coronavirus has a direct effect on the physical health of individuals. However, unlike the effect of lockdowns, it brings about negative impacts on both the physical and mental health of the general public. As the coronavirus pandemic rapidly spreads across the world, with the number of cases per day increasing, it is inducing a highly significant degree of concern, worry, and fear in the large population, and certainly among particular groups such as senior citizens and people with underlying health conditions, and many, many more. The psychological impact when experiencing something completely unpredictable and foreign, combined with the various new variants that seem to be coming out of nowhere, this leads to elevated rates of stress and anxiety. This could be caused by a plethora of reasons, from being concerned about one's personal health to worrying about the health of an elder in the family. Secondly, this pandemic is not just a medical phenomenon. It affects individuals and society and causes disruption, anxiety, stress, stigma, and xenophobia. It is only human nature for us to find someone to blame for such an outbreak. However, in doing so, the coronavirus has been an active fuel to the fire of anti-Asian racism and xenophobia worldwide. Since the outbreak of this pandemic, Asians and people of the Asian descent have been targets of derogatory language in media reports, on social media platforms, and even in statements by politicians. A perfect prime example of this can be seen by the use of the term Chinese virus by the former US President Donald Trump. This has no doubt encouraged the use of hate speech. Not only has there been an increase, no thanks, in racist remarks, but also a shocking increase in racist attacks. Since February, citizens have been subjected to attacks, beatings, violent bullying, ostracizing, threats, and even deaths that appear to be linked to the pandemic. In Italy, as an example, over 50 reports and media accounts of assaults, verbal harassment, and discrimination against people of the Asian descent was recorded. Human rights and other groups in France, Australia, Russia have also informed the Human Rights Watch of COVID-19 related attacks and harassment of said citizens. The spread of xenophobia can sadly be seen everywhere from United States, United Kingdom, Russia, India, and to Australia. This therefore heightens the level of fear in people when leaving their houses to do basic chores such as grocery shopping or even going to school. Finally, we believe that the effect of the lockdown has actually had more significant positive effects on individuals and families than negative effects. It might not seem like it at first, as we tend to shift our focus to the negative side of things. However, lockdown itself can have many benefits. I will now bring your attention to the three main benefits of lockdown. With parents now working from home and children not having to go to physical school, this increases family time spent together. Parents now get more involved in their children's studies and are able to understand what their strengths and difficulties are, and most importantly, how to support and help them. Families also have more time to do activities that have been proven by multiple studies to strengthen their bond, such as playing games, cooking meals, and so on. Research has also proved that this increased time together is a great way for both parties to relieve stress and improve the mental health during such a stressful time. Furthermore, as most restaurants are closed and only certain delivery services remain up and running, as well as the increased caution with regards to eating outside food in fear of catching COVID-19. As a result, many of us are eating more home-cooked food. And as home cooking tends to use a significant lower amount of oil, fresher ingredients, and little to none processed food, it essentially makes it a much healthier option than eating out. Lastly, with the now seemingly extra time that we have on our hands and the increase in the worry of weight gain and such, this has prompted many people to start paying more attention to their health and start working out at home. In conclusion, what have I told you today? I have mentioned how the coronavirus has sparked an increase in the mental health issues of the general public, which I have then moved on to talk about the increase in xenophobia, which also has a detrimental effect on the mental health of people from, for example, the Asian descent.
PY.
And finally, No, thanks. And finally, I have listed out the positive impacts that the lockdown has had on the society, which notably outweighs its harmful effects. Thank you.
You previously mentioned that COVID has caused emotional distress among the population, but compared to the amount of emotional distress caused by COVID compared to lockdown is really inconsequential, because the ratio between affected and unaffected people is like 1 to 100. Actually, way more than that. 1 to 100,000. So how would you justify it?
Well, first of all, I'm not sure where you're getting those statistics and numbers from. So, yeah, but I can't really fight facts if that's what you're saying. But, yeah. Getch, did you also have a yeah, Getch, did you also
Oh,
have
yes,
another
please. Okay, PY.
PY?
So, you said that lockdown improved mental health. So, what about those who are actually, having problems with like low incomes? How are they gonna, have a very good mental health? So, please evaluate.
I mean, nowadays, I think a lot of things currently are being implemented. Like, for example, in Malaysia, we have this thing called the white flag movement, which is so people who are struggling with their income can actually like hang like a white flag or a white shirt, anything white outside, and people will come to help. So I feel like the support that they're getting from their community will help with whatever mental health issues that they might be struggling with, such as anything caused by stress or anxiety. I feel like yeah, just the feeling of being supported and having people to help them out is something that can really help them.
Okay, so now I'll introduce the closing proposition.
All right. So, can you hear me? Am I audible?
Just read it. Yeah, go ahead.
All right. So, first of all, I would like to rebut to what the previous speaker has mentioned. They mentioned that lockdown have very positive effects on families, such as, for example, what they've mentioned, family time, well spent family time. Like, so say, for example, for those families who are actually having problems with finances, they couldn't make enough money due to lockdown and businesses closure, and so they have to stay at home, there's no income coming in. How are they going to actually have a good time spending with their family, meanwhile having financial problems? Secondly, they also mentioned about improving mental health. Actually, lockdown did not improve mental health and instead caused about many other mental health and other problems as well, such as, people getting very depressed, staying locked down in, one room, or thinking about and worrying about COVID and having depression. And also, one more thing that they mentioned is that eating home cooked food is much more healthier and can adjust, seasoning, like say, for example, significant amount of oil. Not all family members loves home cooked food. So say, for example, I have a friend of mine who really hates her mom's food, and she ended up like ordering or going outside for food every time. So imagine those who actually hate home food. How would they actually feel during lockdown? And so moving on to my points. Right. Socially, students from rural areas or disadvantaged home are at higher risk of academic failure compared to students that study in private schools. Lockdown created discrepancy among the education system. Currently, students are expected to sit down in their home in front of their screen for at least 8 hours a day attending online classes. Other than the risk of suffering from symptoms of repetitive strain injuries and eye soreness, students are not accumulating knowledge as effectively as they used to. Students in rural areas face worse challenges as they may not even have access to online lessons for a number of reasons such as poor internet connection or unable to afford the device. This further leads to a catastrophic rise in illiteracy among them. An experiment was conducted in Netherlands that analyzed results of national examination taken place before and after lockdown to evaluate the impact of school closure on students' learning. The Netherlands can be regarded as a best-case scenario with a relatively short lockdown of 8 weeks. The findings conclude that students made little or no progress while learning from home. Learning loss was most pronounced among students from disadvantaged home or places with weaker infrastructure. Results reveal a learning loss of about 3 percentage points or 0.08 standard deviations. The effect is equivalent to 1/5 of a school year, the same point that school remained closed. Losses are up to 60% larger among students from less educated homes, confirming worries about the uneven toll of the pandemic on children and families. This discrepancies between students with different wealth backgrounds contributes to exacerbation of the projected wealth gap. Effects of income inequality researchers have found include higher rates of health and social problems and lower rates of social goods, lower population-wide satisfaction and happiness, and even a lower level of academic growth. Plus, in the event of that COVID pandemic continues in the future, it is unlikely that people from disadvantaged homes will receive job offers that allow them to work from home. Needless to say, people who lack education have trouble getting ahead in life and will be vulnerable to poor health, lack of a voice, shorter lifespan, unemployment, exploitation, and gender inequality. Mild cases of COVID for children will cause 1 to 2 weeks of discomfort and has a mortality rate of less than 1%. Lockdown, on the other hand, has potential to ruin them for life. Yep, so that's the end of my point. Any POIs?
Or
Are there any POIs? You still have like 3 minutes left to speak. Okay, in that case, I'd like to introduce the last speaker for group 6, and that's Adelaide. Is she here?
Yeah, I am.
All right, cool.
Sorry to interrupt, but actually, I have another. We each have another point. So I thought we are gonna basically take the place of third and fourth speaker.
Yeah, sure. If you want, you can say them now.
Now?
Yeah, I'll reset the timer then. Well, right. Where I stopped.
Wait, can I confirm something? Like, am I supposed to rebut all of the points from second speaker to fourth speaker then?
Since there's only 2 speakers per team, I assume that like we would end after 2. But if
okay.
you want to rebut you can rebut as many as you want. Just keep in the time frame. All right.
Okay.
So,
first of all, I'm just going to address the previous rebuttal that states lockdown is the only way of slowing down the pandemic given the circumstances. Well, basically, what I was implying is that I completely agree, but the lockdown it lacks strategy and coordination to compensate for disadvantages. And as a result, for example, in my home country, the Hong Kong government needs to roll out 3 rounds of relief measures due to dying businesses and poverty all over the place. And in many other countries, banks literally have to give out pity money to its citizens due to this lack of foreseeability. Now onto my point. The World Health Organization recommends on curfew and lockdowns, and they state that they should be short-term measures to reorganize, regroup, rebalance resources, and to protect health workers who are exhausted, and to achieve this balance of restriction and normal life. This directly violates the very concept behind the lockdown, and which is dependent on preventing face-to-face interaction to stop human-to-human transmission. And every recess gives the virus an opportunity to wreak havoc again. Countries have halted on lockdown regulations and failed to anticipate a second wave, making the prior months of lockdown completely pointless. And this is an example of how governments fail to foresee the detrimental effects of lockdown. During lockdown, another thing is that during lockdown, exceptions were made for weddings, civil partnership ceremonies, commemorative events following a death, such as wake, stone settling, or ash scattering, and there were also exceptions made to a limited series of pilot events, such as the UEFA Euro 2020 matches at the Wembley, and other whole host of sports and activities, art, music, performances. There are also high employment shares in sectors that are exempt from lockdown, such as agriculture, and in the informal economy, where lockdown measures are more easily circumvented. All these factors mitigate the effect of lockdown. And in the case of French, a group of wealthy individuals were hosting parties in secret, but it got to the attention of the press. And things like this will mitigate the effects of lockdown, as it's not being managed and monitored carefully. Moreover, countries lifting lockdown will try to make desperate protocols to stay afloat. And as a result, it will reverse the effects of lockdown. And this lack of foreseeability, as I mentioned before, will be catastrophic. Aero Mexico, the largest airline in Mexico, flied on July 1st, but planned on doubling its domestic flight and quadrupling its international flights in July, compared with June, as it ramps up operation following strict coronavirus shutdown. And this particular airline, as well as countless others that are on the brink of bankruptcy, will naturally act carelessly like this. And all these factors are not being taken into consideration before the initiation of the lockdown, and this will be detrimental. And Getch? Getch, you have a point. You must say.
Sorry, I don't think we have enough time for that. Can we just move on to the next speaker?
All right, then.
Sorry about that. Adelaide, would you be happy to start speaking?
Okay, yeah.
Right, thank you.
Okay, starting in 3, 2, 1. Proposition has been stating statistics over and over again, but they have never really explained the rationale behind reaching these conclusions. We believe that the burden of proof for side proposition is to prove that both the economic and social harms of the lockdown outweigh the harms COVID-19 has brought to the physical health of the population and to the economy. They have not really explained to us why the health of citizens should not be valued over the economic impacts brought by the lockdown. Thus, we don't think it's sufficient for them to win this debate. I believe that proposition has actually neglected one very important thing. The people make up the workforce, and they are the people who build up the economy. Without the general population, we're unable to expand or even sustain the economy to bring the long-term benefits, as the first speaker of proposition claimed. We as opposition recognize the economic and social consequences of lockdown measures being put in place. They thus are in no way belittling these consequences. However, we do not think that the harms brought by the lockdown are greater than that brought by the coronavirus itself. With that said, in addition to the point my partner clearly elaborated earlier on the harms on the physical and mental health of citizens, I'll be explaining the economic harms brought directly by the coronavirus. I'll first elaborate on how the virus is detrimental, then on why these economic harms are important, and lastly, why these harms outweigh the harms brought by lockdown measures. First, though, some rebuttal for my previous speaker. She said that these students are not accumulating knowledge as well as they used to, especially for people living in rural areas. And she used Netherlands as one example to prove how online teaching is not beneficial. We do not think that the situation in the Netherlands is actually a representative of the situation in the whole world, especially in Hong Kong. There have been 5 times more full mark scorers in the annual IB exam this year compared to a normal year. And it's said that these students are actually excelling during these situations where online teaching is actually in place because they have been spending more time revising rather than doing other activities and are thus achieving higher scores. Not saying that this is the case in over the world, but then there are both advantages and disadvantages to online learning, and its effects cannot really be concluded at such an early stage of implementation of online learning. Secondly, no thank you. Secondly, she also said that the consequences of online teaching and the lockdown would lead to unemployment because these people wouldn't be able to gain enough knowledge. Therefore, it would lead to exploitation and gender inequality. This, again, I find that there is a very huge flaw in this argument. I think that this is a slippery slope argument in which these consequences have been exaggerated. So we do not think that this is a likely situation to happen. Next, I'll be moving on to rebuilding my team's case. The previous speaker from side proposition mentioned that some families may not be able to make enough money, so their mental health would be affected, and they wouldn't be able to spend time happily with their family, as my first speaker from opposition has said. Governments across the world have mostly implemented other policies simultaneously with the lockdown, such as partially, if not fully, funding the wages of workers and businesses to incentivize these firms to retain their workers. Therefore, a lot of these workers, while they are unable to attend work, have still been receiving their wages. Moving on to my first point, the coronavirus encompasses irreversible wider economic harms that are more detrimental compared to those brought by lockdowns. There are 4 main reasons to why this is true. Firstly, the coronavirus affects the productivity of the economy. Taking the UK as an example, from the start of the pandemic, there has been 128,000 deaths and more than 470,000 cases of hospitalization. With so many deaths caused by the coronavirus, there has been a permanent decrease in the labor force, negatively impacting the productivity of the economy. Even though the majority of people who were infected have already recovered, there are also long-term complications that may deter these people from working to their maximum productivity level. After COVID-19 infection, it is said that some people may also experience other symptoms, including fatigue, problems with memory, and concentration and chest pain. These complications are unrelated to the severity of symptoms when patients are first infected with COVID. With such complications, it is evident that a great proportion of citizens will be affected, drastically affecting the productivity of the workforce. Thus, there will be negative effects on the GDP of the economy, and foreign companies may be less willing to invest. This leads on to my second reason, which is the fact that multinational companies may be less willing to set up their headquarters or production bases in countries due to the COVID-19 virus. With the different variants of the coronavirus mutating, there's so much uncertainty within the economy. The coronavirus has disrupted production schedules and created challenges in sustaining productivity in certain industries, mainly due to sudden outbreaks of the virus within companies. It is unknown when citizens and businesses are ready to operate in full capacity, and all of these possible problems that may arise have made investors reluctant to invest in places that have serious outbreaks of the coronavirus. Instead, investors may choose to invest in alternate countries which have the similar level of economic development but have less coronavirus cases, so as to reduce the risk of losses, lowering the amount of investments. This may lead to the decrease in the amount of money and the circular flow of income, affecting the GDP of the economy. Thirdly, with the coronavirus, tourism has vastly decreased, leading to a shrink in the tourism industry, in which people, in terms of profit and employment. Due to complications COVID-19 may bring, a lot of people are reluctant to travel to countries with large amounts of COVID-19 cases, so as to lower their chances of being affected. And this has heavily impacted the tourism industry, with a lot of companies closing down and people losing jobs. With such an unpredictable and unforeseeable future for the tourism industry, it has also impacted investments in this particular industry. Therefore, it has also decreased the GDP for economies. Lastly, the coronavirus has led to an immense burden on the healthcare system. Due to the sudden surge of hospitalization, there has been a lack of equipment in hospitals, such as ventilators. As a result, governments have been spending more money than normal years to source resources at higher surprise them to buy additional equipment. For example, like in the UK, the NHS has already been in a deficit, but then the coronavirus has led to a greater strain on the healthcare system due to the large number of people being hospitalized. And this has led to more borrowing done by the government in the public sector, increasing the interest payments and debt to the government is in, which leads to crowding out in the private sector. So now that I have proved the detrimental impact COVID-19 has brought to the economy, I'll be moving on to explain why these economic impacts brought by the coronavirus are more harmful than that of the lockdown. There are two main reasons for this. Firstly, the economic harms brought by the lockdown measures are temporary, whereas those brought by the coronavirus are long-term. With problems like a reduction in spending within the economy, these can be reversed when the economy eventually starts to open up, for example, with the vaccine rollouts. However, with economic harms like a lowering in productivity due to deaths and serious complications, it is impossible to reverse. You cannot bring dead people to life. People suffering from complications related to like the lungs, heart, or brain after treatment are likely to continue to be affected. Thus, it shows that productivity will be affected in the long term, and the long-run aggregate supply of the economy will decrease. Potential economic growth will thus be affected. And while economic impacts brought by both sides are valid, we believe that the long-term economic harms are more significant than the short-term harms. In addition, the economic harms brought by the lockdown can be reversed, and the economy can recover through government policies. Examples would include providing transfer payments to citizens to encourage more spending within the economy to generate consumption after lifting these lockdown restrictions and increasing the GDP. And secondly, after examining the situation on a larger level, the reasons why lockdowns are in place is due to the COVID-19 virus. This shows that the economic and social consequences of the lockdown are actually some of the harms partially related to the COVID-19 virus. Lockdowns are part of the measures taken to control the COVID-19 virus from spreading. Thus, the root cause of these harms brought by the lockdown is the fact that there is this pandemic. Therefore, it's evident that the harms brought by the COVID-19 virus outweigh the harms brought by lockdowns. I'm proud to oppose. Thanks.
I would like to report that the speaker made some false claims regarding my argument, and it's all right if I reiterate a few things. Or do we not have time for that?
Okay, sure. You have like around 3 minutes, and we are a little bit late, but just quickly. Thank you.
All right. So the speaker mentioned that I neglected to explain why economy of a country is valued over overall happiness and content. And here I've said that growing economy turns less into more, and this surplus of goods and services makes it easier to improve certain standards of living, which generates happiness for the long run. And lockdown impedes this paramount principle, which strives to save lives in a reckless manner. Next, the speaker also mentioned how Hong Kong has the academic ability of Hong Kong has excelled. I would like to say that we are emphasizing on the fact that the toll of the pandemic. We were emphasizing the fact that there were uneven tolls on the pandemic relative to students from different wealth backgrounds, and not the fact that it has affected certain academic abilities, academic excellence of a country.
May I please rebut whatever he said?
Sorry, we're a bit late. I don't think we have time.
Oh, okay.
So sorry, very sorry. I know, I understand. Anyway, regardless, thank you for your debates. They were very thorough, and I know you wanted to speak a little bit more. Maybe we can do that another time. However, I'd like to conclude the session by talking a little bit more about our charity that we've decided to have on our event today. So let me share my screen, and we can see the final donations. And then I'd like to introduce the next session that will come on the 25th of July. So, oh wow. So these are the, this is the money we've raised so far. Our target was £35, and we've massively exceeded that. So I'm very happy about that. So thank you everyone I'm sure everything will go towards a good cause. Everything helps here. So very happy, and thank you, NHS Charities Together. Next, I'd like to introduce our next session, which is autoimmune. So if you were to look at the website, we're going back to PBL after having a pretty successful debate session for our second session. And our website is updated with all the different topics that we will be covering on the 25th. So the same criteria for the presentations, you can add whatever you want to it, but we'll also be looking at all these topics, and every group would have presentations just like the first session. Finally, I'd like to say that this recording would be made available on the website once again, so please feel free to check it out. Anything you want to say?
Yeah, thank you everyone so much. So please do contact us. Send us an email if you would like to be a part of the next session. The sooner we know, the easier for you to make the presentations and for us to know who's taking part. And if you have not already voted for which side of the debate you think was more convincing, then please do, because it would really help the people that debated for them to have that feedback. And I think that pretty much concludes today's session. So thank you so much for staying with us all day. And yeah, it'll be good to hear from you about the next session very soon. So thank you all.
See you soon.
Bye.